that.
Nope.
But he stopped me and we talked about some pictures on his phone. I was a little surprised, but maybe not so surprised. Sean?
I wouldn't say that. I was trying to warn you because I saw you're maybe going to your guest room and where you're staying, and I had just come freshly from my room stay. And anyway, after checking in, I just wasn't happy with the sanitary level that my room had been delivered to me.
So as cleaners and restorers, we might be pickier than some, maybe not. I personally don't enjoy hotels. You probably don't either.
No.
But we want a clean room.
You know,
let's talk about what you discovered, your experience, and then the takeaway we can get from this.
You know, I check into a room and I don't generally bring my inspection lights into a guest room for the same reason. I don't want to I can't unsee it. And as it came down, I accidentally brought my UV light in, and I decided to open it up and turn it on last night after getting back to the room. And I already wasn't quite pleased with the absolute visual part of what I just saw when I came in. It didn't seem like it really was a cared for room.
We've all been there.
And I, unfortunately, decided I wanted to approach management for no other reason than just trying to make it better. You know, I really wasn't trying to be angry about it. I wanted to make a suggestion. So I decided, after taking a video of this room.
Let's look at all these pictures and videos.
I went ahead and I took a quick view of the room as I got there and started previewing around with, like...
What's that?
This could be more of a sweat stain or something else. It's on the back of the chair, but some of these pictures on the bottom and on the ottoman piece...
Is this after you sat on all this?
I had my jacket on it, and I actually, after taking it, I was like, oh, and I no longer feel comfortable anywhere in the room. I mean, the carpet had signs of under the UV. Everything was signed. It just wasn't cared for. Whether it was a questionable thing that you might think it was, blood or other bodily fluids that it could have been, there are other cleaning agents that will reflect like this, but it just showed not very good care. And like they really weren't cleaning at the level that I thought a property like this could. And I pay for.
Right. Let's see the video.
The video, I mean, I did a comparison of regular lighting.
Okay. That looks dirty, but not scary.
But not scary. And then I went over and did it the exact same.
This is the black light?
With a black light on it.
And
365 nanometer. Just
I wonder what that is.
I wonder. There's some spots that I absolutely...
Let the viewer beware.
I don't want to know. And I can't unsee it. Anyhow, I did ask for management to give me a call or to come to the front desk, and they chose to not. They sent a message to a different department within the property, to someone else's problem. They didn't accept the ownership of it, and all I was just looking for an acknowledgement, because I didn't think I'd find any better. And I don't think they have a higher hospitality standard to be able to give us better. So they sent someone to the management on the other team of the property and hospitality and housekeeping. They never showed up. I still have no message about it. I didn't get an offer for an increased room, an improved housekeeping habit, nothing. So it's disappointing because I'm not at a lower street level hotel off the strip. Mm-hmm. I'm in a nicer property. And I think they should have a higher standard.
So Sean, the takeaway from this is obviously we want to clean hotels. Maybe look at the reviews. Complain, you did that, it's not going to do any good. But on the job, when you're doing an inspection in a home or a business, and you see something like this, you're asked to maybe do an estimate.
Yep.
And you see something that needs to be addressed. How do you take that information and turn it into a positive to where you can do the job right and fix this issue?
Yeah, because oftentimes when we do that, we bring these lights and things, show the client, they're like, I don't want to clean, throw it away, give me a match and some gasoline. And we can make it more sanitary for them. We can explain and interpret what we're seeing as that's dust, and think maybe not cleaning the edges as much as showing that versus that's a contaminant or a spill or something that happened that shows maybe an unhealthy level of concern. And I think I look at it really deeply in my restoration company, because a lot of my clients will bring these lights and inspect after we've done. And we're not perfect all the time in creating what we've done, and we need to be accountable to that level of under that kind of a microscope or bright light or different light and what we're cleaning for and what we're achieving as cleaners and restorers, because what more is restoration and managed specialty cleaning.
So this experience here at the hotel, when you saw that chair and the ickiness, I mean, we could probably have that test and see what that is, but that's another story.
I didn't bring the biological swab tester.
Good, because you'd be staying at a different hotel. But I guess my question is, if someone were to come in and inspect and like you did, what would you say would need to be done to fix that?
Thorough cleaning. There are In this case, I think the better choice in this solution, because of the fabric and the textile, is to replace it
Okay.
and not try to clean it and make it acceptable or answer for what might still be visible
So as a
after
cleaner,
cleaning.
you would recommend that at times?
I would, very frequently. When I don't think it's sanitary or recoverable to that tolerance, we'll recommend to replace it or live with what we've shown you that it is. Because we can't always even clean the residues that I'm seeing on this. Some of it isn't what we would interpret as real contaminant, but actual residue or ghosts of the cleanup of the phosphorus and other things that fluoresce. So it's being accountable to what that actually is. You know, is it sticky? Is it smelly? Is it visual under a UV only?
What it sounds like to me, Sean, is you're talking about being a consultant instead of just selling a job and being a technician.
Absolutely. Educate your customer. Make sure they understand why you're helping them. And it's not just this price off of this menu, but here's what we're trying to deliver so you can do better later.
All right. Enjoy that room tonight.
I'm not sure I can. Sleep with maybe one eye open.
When I open. Thanks, Sean.
Take care.
Hello, this is Governor J.B. Pritzker here to recognize March 23rd through 29th as International Cleaning Week. This week and every week, we're saluting the hardworking cleaning professionals who keep our state sparkling. The cleaning industry is essential, safeguarding our health and helping fuel our economy. According to the International Sanitary Supply Association, proper cleaning and disinfection slash virus concentrations by 42%, and with proper hand hygiene, that soars to 85%. I want to thank the ISSA, which has been headquartered in Illinois for over 100 years and has promoted the employment of thousands of Illinoisans across 300 member companies in our state. And to the workers on the front lines every day, I recognize this work is often thankless, but your selfless dedication does not go unnoticed, and the state of Illinois appreciates you. Happy International Cleaning Week.
As a cleaning industry professional, and especially for those watching right now who are ISSA member organizations, what is your focus? It may align with the ISSA brand promise, which is changing the way the world views cleaning. How do we make real change? It comes with initiatives that focus on improving what we do in the industry. The EPA Safer Choice program is one such initiative that is in the spotlight today. Yet you might say, I've heard about this program years ago. That may be true, but some emerging news has amplified the reach and value, and you'll want to hear about it today. But I'm not the one here today to divulge what this is. Let's welcome our three panelists. Let's start with Dr. Gavin McGregor Skinner. Gavin, tell us a little bit about yourself.
Yeah, hi, Jeff. Happy New Year. I'm the Senior Director at ISSA, and I collaborate with both the people on this panel today in a project called Making Safer Choices.
Thank you. And Dr. Rebecca Bascom, can I call you Becky?
Sure.
All right. Tell us about yourself.
I'm a professor of pulmonary medicine in the Department of Medicine, Public Health Sciences at Penn State. I'm also a lung doctor and delighted to be working on this project.
Glad you're here with us. And last but not least, Dr. Amrana Pasha Razak, tell us about yourself.
Thank you so much for having me, Jeff. And it's a pleasure to work with Gavin and Becky. I am a professor at the City University of New York School of Medicine. I am an internal medicine physician, an internist, and an epidemiologist. I work in the Department of Community Health and Social Medicine with a focus on underprivileged and vulnerable populations.
And you really like women's health too, and mothers and children. That's
Right.
one of your big things, which I think is completely pertinent for this project.
Because 80% of people who are directly involved in the cleaning process are actually women.
I think what people now understand is that the three of you know each other pretty well.
We do.
Very
So
good.
Gavin and I worked together at the pandemic, the time of the pandemic,
Mhm.
and um, had a very similar focus, which is how do you come up with practical approaches to big problems? And COVID clearly was a big problem, and cleaning is something that so many people do. And there's so much progress that can be made. And I think I like this project because it's practical and it's connected to the real world through ISSA.
Appreciate that. The only thing I wish is I had doctor before my name, but I'm just gonna have to put up with not having that. So, uh,
Yeah, but
but
you're editor, so you've
oh,
got the
okay,
big
okay.
power.
So we've teed this up a bit. We're now interested what this news is. We all know what the EPA Safer Choice program is. Dr. Gavin, tell us about this big news that we're going to get into.
Jeff, so we have a project that we've been working on. It's called Making Safer Choices, but two significant events happened in 2024 that we wanted to share with everyone. So in April 2024, the federal government directed that all federal agencies need to prioritize and purchase sustainable products and services. And the change that was reflected in the US General Services Administration. This is the organization that does all the government contracts. So they oversee 600 cleaning service contracts for more than 1,500 US government buildings. It's about over $400 million annually. They mandated the purchase and use of cleaning products and hand soaps that are certified with eco labels, such as the EPA Safer Choice and a couple of specific Green Seal certifications. So that happened in April. Then what happened in December 2024 was that the National Defense Authorization Act for the fiscal year 2025 went through the House of Representatives, to the Senate, over to the President, and was signed into law December 23rd, that authorizes the appropriations for all military activities in the US Department of Defense. And there's a section in that act that says the Secretary of Defense shall procure, to the maximum extent practicable, only those cleaning products that are identified under the Safest Choice program. And that's what we're doing. So now we have both federal government buildings as well as all the military installations. There's military installations, military buildings, as well as aircraft carriers, planes, tanks, cars, vehicles in every state of the country now. A great opportunity for the whole industry, as well as academia, the university partnerships we have, to help people create new contracts and make safer decisions.
Well, this is big news. Gavin, thank you for sharing that. Dr. Beck, anything to add?
Well, I think that when I hear about a program that reaches so many people, I think it's a huge opportunity.
How do you envision this initiative transforming cleaning industry practices, and what kind of a timeline are you looking at?
The timeline is short. We're doing this really in an intensive way in the next year. We're looking carefully at what other people have done that works. So we start off with a phase we call exploration. We're going to be reaching out to people in the ISSA industry to say, what do you do currently for training? What languages do you train in? What works for you? And we're going to connect the lessons learned to the gaps identified. And the gaps will be identified by talking to industry leaders and also people that are making procurement decisions, buying the products, and people that are using products. So we're saying, what do you see as to what's working and what isn't working? And then from there, we're saying, what are your ideas as to how to do better training? And then connect those into training videos, training sessions that then can get to the ISSA website, which is this amazing dissemination platform. A lot of people can go there to find their information. So we're going to ask, we're going to listen, we're going to innovate, and then we're going to reach out.
A lot to do in a year. Gavin, can we do it?
Yes, we can, because it's the power of collaboration, Jeff. And it's the power of collaboration through ISSA members, as well as working with two fantastic universities, one at Penn State and City University of New York. And You know, that power of the people, the different skill sets that we have, and the different networks that we have, and the communities we're going to create, and the partnerships is going to just to be it's going to be a fantastic journey, 2025.
Mm-hmm. It'll be good to see. Becky, back to you, and then we'll go to Amrana. What types of tools or training are being created to help businesses adopt safer choice certified products?
A lot of different tools. We're talking to people of all ages. I've learned about TikTok. I mean, turns out that there are some people that get their information from a TikTok video. And we have people on our team who are in their 20s, and they think the way to train people is with a TikTok video. We talk to people in their 40s. They have a very different view. Some people want to see it on a screen. So there's no single way to train people. But what you need to do is understand how and when training occurs and how good information gets transmitted. And once you understand that, you can design very effective training, and ISSA can then disseminate it, send it around.
Yeah, I've tried TikTok a few times, but I'm not too good with it. Amrana, you might TikTok.
I actually do not, but
Oh.
my students tell me at the School of Medicine that a lot of our patients, especially those that live in low and middle income areas of New York City, get a lot of their health information from TikTok. And I think that that is likely to be true for a lot of people who are at the end users, both of the products that we are talking about, but also the end consumers for the training materials, so the actual cleaners. And I think that the fact that we can approach this in a variety of different languages, that is part of the strength of this collaboration. The fact that we can approach this in a variety of different ways, in terms of the output, whether it's TikTok videos, it's written material, it's video training type of videos, will allow us to reach a maximum number of people who are actually the target audience.
Mm-hmm.
So I was walking through airports, and I've been looking at the cleaning staff in an airport. They all have phones. Their cleaning products may or may not have a label on them all around the world. They may or may not have, they certainly won't have a detailed material safety data sheet on their cleaning cart, but they all have phones. So we need to think about how to train with the resources and products and tools that a cleaner has with them at all times.
Good information. Yeah, everyone has a phone. We all can use them to access what we need, that's for sure. Let's talk about a little bit of manufacturing. Where are these products manufactured? So many of them, and more will be added to the program. Gavin, talk about that and what this means for this program.
Yeah, really important question, Jeff, because when we talk about eco labels such as the EPA Safer Choice, what is that? And the real important point is that nearly all of the EPA Safer Choice products, over 2,135 products, are actually manufactured here in the US. So they're by American US companies. So when we're talking about this, I'm going to hold up a product, Jeff. This is a product that I use. That little label, if you can see that label there, that's the Safer Choice label. And one of the challenges that we have in our project here is to see what is the awareness of that label. So how do we increase knowledge, demand, and use of these products if you don't know what the label is? And the label is not just the point that in those products there are safer chemicals, safer ingredients for cleaning, but these products have been evaluated for performance. They have recycled content. So every manufacturer has to make these products with at least 95% recycled content. There's an air quality component in the criteria under the Safer Choice standard that each product can't expose or release anything that's 10 microns or less. That's those particles, Jeff, that we can breathe in. So that has to be tested. We look at waste products, we look at packaging, we look at performance. Each product that carries that label must perform as well or better in comparison to leading brands that already exist without damaging the surfaces, without influencing the air quality. So it's that increasing that knowledge, Jeff, of that label. Then, as we saw with both the federal government and now the Military Reauthorization Act, there's going to be change in contracts. And as Becky said, then we've got to work out how do we use those products and how do we use them in the way that the manufacturers designed them to be used. And that's going to take a collaboration. That's going to take partnerships. So again, label recognition is going to be the key. We're doing baseline surveys and focus group discussions now in both New York and Pennsylvania to learn how do people make decisions on what gets cleaned, how it gets cleaned with what product, how do they buy and purchase those products, then how do they train to use those products?
And we really are seeing that that a little knowledge goes a long way. So a member of our team who was brought on board for a very specific knowledge that he had, he'd never heard of the label. And he came back the next week and said, you know what? I've got that label in my cleaning products. So he was, once he saw it and got interested in it, he was able to see it in a completely different context in his daily life as he was looking at his home closet.
Yeah, it's the impact of what everyone's doing here.
Yeah.
Amran, anything to add to that?
So, I think one of the key points that really is a strength of our project is the fact that we are moving up and down the value chain, as Gavin has taught me it is called, from manufacturing all the way to the people who do the actual cleaning. And the cleaners may have never heard of these manufacturers. They may not know anything about where the products that they are using are coming from, or sometimes, unfortunately, even how they should be used appropriately. So helping to make those links along the value chain, I think, will be one of the key strengths that we'll bring to this.
Amrana and Becky, I want to ask you both this question. Amrana, you first. Are there benefits for businesses that switch to safer choice products? Because they're going to wonder what's in it for them.
Well, I think that there are two things that I really want to highlight. One is the health benefits. There are known harms that can occur to people, there are known risks that with some of the less safe cleaning products that are out there, including skin diseases, skin damage, lung diseases, eye irritation, endocrine or glandular disruptions, and also carcinogenic or cancer-causing effects. These are what are known. For my interest as a women's health person, what is not known is what the impact of these some of these unsafe products is on the fetus, on pregnant women who are involved in the cleaning industry. So there are both harms that we know about and harms we don't know about that can occur when people make choices that are less safe. The safer choice products, making safer choices means a healthier workforce, a workforce that has fewer harms coming from the products that they are exposed to. And I think that is sort of the biggest advantage. The second thing that I was really interested to hear, and I know that a lot of people who are involved in the cleaning industry ask this question, is are these safer choice products as effective at the cleaning? Will I have to work harder? Will I have to put in more elbow grease if I use a safer choice product? And what we're saying to them is no, they are as effective or more effective than less safe alternatives. So I think that those are both advantages that companies that switch to safer choice products have.
That comment is what we heard with the green cleaning movement years ago when products were brought on, people had that same question. Are they going to work as good? Thank you for answering that, Amrana. Becky, anything to add?
Uh, uh, I've worked with companies who were addressing health issues in their workplace. And the thing that I've learned time and again is that when you pay attention to a process and make it better, make it more efficient, make it safer, you may start by doing it for the health of the people doing the job. But oftentimes it translates into a better process, a more efficient process, and so a more cost-effective process just for the job itself, to say nothing of the avoided cost of a health harm to a workforce. So I think that this project is a very sensible one, as borne out by previous projects I've been part of.
And Gavin, what would you say to this? Anything else?
Yeah, just one thing, Jeff. One of the key strengths of this whole entire Making Safer Choices project is that a trade association, ISSA, is collaborating with university professors that are really good at research. They're really good at identifying what the current knowledge is, the attitudes, and the barriers to purchasing and using cleaning products. And that's going to drive us forward. A lot of these questions that we're talking about sound fundamental, but they're not. They just haven't been asked. And they haven't been asked, Jeff, at scale. And when we go to scale and we cover schools, hotels, government buildings, military installations, airports, stadiums, convention centers, beauty salons, churches, all the different sectors that we're going to penetrate, we're going to get some really interesting answers that will work with the university professors to say, what's the solution? What's the next step?
There's a willingness to look at this area in the cleaning industry. I say that because I see patients in clinic who have lung injury, and they reflect on their work and they say, I could have used a better product, but I didn't know better. And but there's a willingness of people to do the job well, do their job well. They want to clean. There's a strong sense of professionalism among cleaning people who do cleaning, but also a willingness to protect their health and to take the steps to get the training to know how to protect their health. And I think that's what's so much fun, really, about this project, is to connect to people who are on the ground like ISSA is, and people who think about groups of people like Omrana does, and people who listen to people's lungs like I do. I think we're all in it to work together.
Thank you for that. Let's stay with you, Becky, on this next question. We'll wrap up in a few minutes. This project is focused on two states. We talked about that, New York and Pennsylvania. What strategies have you been talking about with your team there and with this group to ensure the longevity and scalability of this beyond Pennsylvania and New York?
Yeah, that's a great question, because what we don't want is to do this work and then have it stuck in a closet or in a paper, and not be out there working for people. And the ISSA dissemination, they've got this, they've got a reach. ISSA has a reach. And if we put together products, podcasts, things that are available, that someone can go to a link and find it, they can get their information. It'll be there. It'll be a multimedia library, if you will. So that's number one. Number two is we're going to figure out where a podcast online will be fine and where person-to-person contact is needed. And so we'll be able to make recommendations about how to move this thing forward. And then ISSA, through their members, can share that information and figure out how to make sure that this project has legs.
I like that because we want to see this grow and get bigger and better.
Yeah.
Gavin, anything to add to that?
I think it's really important, Jeff. This is important, and as Dr. Arana said, the value chain, that's that entire cleaning industry, the users, the purchasers, the retailers, the product formulators, the ingredient manufacturers. If there's one thing a trade association can do really well is we can collaborate and bring everyone together under a partnership with purpose. And that's what we're focusing on, a partnership with purpose, working with academia, with university professors to answer some questions that we just don't have the answers for right now.
Mm-hmm. Amrana, let's ask you this last question, then we'll get Becky and Gavin to add. Because at the end of the day, we have to know it works. How do you measure the success of a project of this scale?
I am a huge believer in the forgive me because I'm not a native English speaker, so if I get my idioms wrong, but the proof of the pudding is in the eating. We need to see when Becky is walking through airports in the next year, at the end of this period, and perhaps after a second project to upscale this our work, does she see safer choice products on the cleaning carts in the airports? Are we really able to increase the uptake and usage of safer choice products? And we won't be asking Becky to walk airports across the country, but we will try to measure uptake through ISSA members, an increase in uptake of safer choice products as the final or one of the final measures of our success. Are more people buying it? Are more people using it? And are more people aware of it?
I personally volunteer to walk the airport like in Hawaii and look for products if you want me to. So I think there's volunteers out there.
Jeff, you're second on the list.
Oh,
My name's already up there, you know.
I can find other nice warm tropical places if, you know. Thank you, Amrana. We appreciate that. Becky, what would you add to what Amrana said?
When something takes hold, it often takes hold on many levels, and it takes a while to watch it grow. And so I think we're going to be monitoring things at all the different across the value chain, and continue to monitor what's working and where the gaps are. I think we're in this for the long haul, but we want to make a difference in the short term.
Absolutely. And we're going to wrap up our session today. Gavin, share your thoughts here and maybe a call to action for those watching. What should they do? End with that.
Well, Jeff, this is the beginning of 2025. By the end of 2025, it's all about storytelling. It's about being able to listen to narratives on how people clean and how they made those decisions to clean. This project has been, again, so much work and thought has gone into this with the three partners. We have a plan. We're going to conduct surveys and focus group discussions. We're going to look at the current knowledge and attitudes and barriers to purchasing and cleaning and using cleaning products. We're going to develop community-designed education and training solutions on purchasing and using safer choice products. We're going to package all of that into toolkits, playbooks, and videos. And as Orana would tell me, we're going to make sure that language is not a barrier. Other social issues aren't a barrier. The location where you live is not a barrier.
If you've been watching the news, the United States has announced its intention to withdraw from the World Health Organization. Some may be wondering what this means for them, personally and professionally. To comment on this, I'm pleased to welcome Dr. Gavin McGregor Skinner, Senior Director at ISSA. Gavin, welcome to the program.
Thanks, Jeff, and it has been a busy week.
I think most of your weeks are very busy. And when something like this is announced, you probably get busier. Gavin? Initial thoughts.
Yeah, I think the challenge we have, there's a gap there, Jeff, with the industry is what does the World Health Organization do globally? Well, they have 194 member states. That's really countries and other states that, 194, very representative. I've been on a number of deployments, Jeff. My personal experiences working with the World Health Organization. 2004, I had a 9-week deployment to Indonesia for the tsunami response. 2014, I did 3 deployments to West Africa for the Ebola outbreak, setting up, managing Ebola hospitals. I've had 3 deployments to Afghanistan, 2 deployments to Iraq for really strengthening, prevent, detect, and respond to infectious disease threats and looking at systems. And I can say that those deployments, the work that I did with WHO or World Health Organization, is about successful coordination and collaboration. And that's what's really a good point to everyone. Understand that the world does need an international infrastructure to fight infectious diseases.
So that makes sense. And thank you for all you've done through your career to help combat these infectious issues. Some might wonder, how is the traditional cleaning industry tied to this decision? Is this going to impact our frontline workers, those who are part of ISSA?
Yeah, good question, Jeff. Many of our ISSA member companies are international. The point that I'd really want to highlight to everyone in the industry that, yes, you may hear that the US government might, withdraw, and they've done it before. They've withdrawn from the World Health Organization. But more importantly, that's going to leave a gap. It's going to leave a massive vacuum when it comes to prevent, detect, and respond to infectious disease threats. And really want to emphasize that America cannot stop the pathogens from crossing its borders. Let's look at Ebola, Jeff. A person hopped on a plane, landed at an airport, went to a city, went to a hotel, went to their apartment, went to a hospital, and spread the disease. And we've seen that happen many times for other diseases. So really, I think right now we need to talk about what the cleaning industry could do and how they do it. And it probably doesn't take a lot of money to do what they need to do if we do withdraw from the World Health Organization.
So, Gavin, despite how you might feel about this withdrawing from the World Health Organization, you see this as a possible opportunity for the industry.
Yeah, whenever there's change, Jeff, it creates emotions. And we've seen a lot of emotions come out this week. But whenever there's change, then you have to bring the team together, the community, and come up with what happens next. And so from the cleaning industry perspective, we need a coordinated effort. We need to, again, educate, train, make aware of what is our role in preventing and responding to infectious disease threats. How does the entire value chain of the cleaning industry, how do we build technical capacity? How do we strengthen supply chains for equipment, tools, and products? How do we, as a community, as a cleaning industry community, continue to establish technical norms, standards, and guidance? And so I'm going to throw out 3 things here, Jeff. Right now, this team needs to come together. That team consists of anyone that creates or delivers cleaning products. That's the first part of the team. Manufacturers, distributors, wholesalers, retailers. The second part of the team is anyone that cleans buildings. Building service contractors, in-house service providers, residential cleaners. The third part of the team is anyone that operates buildings or facilities that need to be cleaned. The building owners, the facility managers, the operation managers, the supervisors. Because as we saw when we had Ebola, when we have flu, when we have norovirus, when we even had COVID, there were critical gaps on how do we clean. And if we could get that team together, those 3 key parts of the industry together, come up with solutions, tell the world, this is what we do, this is how we do it. These are the critical methods and procedures to clean and disinfect to decrease the likelihood of those infectious disease spreading, because history's shown us. Person hops on a plane, lands at an airport, you've got the disease.
History tells us that, and a lot of movies too. So there's that.
Yes, Jeff, there's been a few good movies, and probably now's the time to get back on your Netflix, Prime, whatever account it is, and watch a few of those movies.
To scare you straight, maybe.
Maybe.
So, Gavin, it sounds like as this develops and this withdrawing occurs, trade associations become even more important.
Yes, what the US government does, they'll make decisions, but what they do is going to leave critical gaps. And we as an industry, so ISSA, leading association for the cleaning industry, if this happens, we should be now preparing a plan and working out how to fill that critical gap. We've got the World Health Assembly. This is the World Health Organization. Big meeting occurs in May. The government's going to handle that. They'll do that. Parts of the non-government private sector do attend. But we've also got International Cleaning Week, March 23rd to 29th. We want everyone to come together to look at solutions. But more importantly, let's distinguish those critical methods and procedures, Jeff. Let's look at where we set the standard of care for the industry. And let's look at how we work as a team to continue to create healthy and safe built environments and also then prevent diseases spreading. We've got big norovirus, big flu outbreaks happening right now. And again, we're seeing our members respond appropriately.
And it's good to see that happening, the collaboration. Well, Gavin, we have a lot to do. Let's get going.
Sounds like a plan, Jeff.
Today, I'm with Dr. Gavin McGregor Skinner, Senior Director of GBAC, which is a division of ISSA, along with a special guest, Doug Hoffman, the Executive Director of NORMI. Gavin and Doug, how are you both doing?
We're in Florida, Jeff.
What does that mean? Does that mean things are great?
Yeah, it's just amazing, Jeff. Just the power of ISSA, our trade association, the alliance that we've had with NORMI now since 2018, and it just keeps getting stronger every day, especially here in the state of Florida.
Fantastic. And Doug, we do value your partnership. Thank you for all you do with ISSA, and of course, to support our members and those that are part of NORMI. But I understand something happened recently, and that's why you two are in Florida. You're not on vacation, but you're working, right? You're working.
We're working. Sure. Yeah, we're working.
What's the news?
There's two big news items here, Jeff. The big news item is that Doug and I have been talking about training facilities, globally throughout the world, schools, universities, community colleges. When you put people in a classroom, we know that they spread droplets through coughing, sneezing, talking, singing, if you go to those sort of classes, and that spreads germs. And then Doug and I were talking about, well, then how do you clean a classroom after a training to make it safe and healthy for the next class? And so the NORMI Pro Academy, which is a wonderful training center in Sunrise, Florida, has gone through the GBAC Star accreditation program. And really, it's about telling their cleaning story. Is it based on best industry standards, science and evidence, which it is? I've now done the site visit. We've filled out the documentation. So the NORMI Pro Academy in Sunrise, Florida is now a GBAC Star accredited facility, following our 20-element program, which really brings them into the family of being a certified ISSA training facility for all of the ISSA members.
And I can't tell you how excited we are about this. I think bringing this to the table for remediators, especially mold remediators that we do so much training for, indoor air quality specialists, this is really just a perfect marriage in a lot of ways, because all of them do cleaning. They need to know how to do it correctly. And so bringing this side of the industry together, this merger, as it were, is pretty cool.
Yes, I agree. Now, Doug, you've been doing training for a long time, and obviously working ISSA and NORMI together is a smart move. Tell us about your training center that makes it special, and why will this be such a good thing for the industry?
Well, the unique thing about our training center is we've been doing Zoom, of course, for a really long time, Zoom training. And so we took this classroom and created essentially a television studio. So when we do training at the NORMI Pro Academy, we can do it on site, obviously, where we can do hands-on training and so forth. But Jeff, we have 4 cameras, 16 microphones, and we have 3 televisions there. And so what we can do is we can actually broadcast live online training while we're doing on-site training. We call it simulcast training, and that's been incredibly effective. Think about the last couple of classes we've had. We had someone flying. We had several people from the UK. So being able to offer that kind of level of training and not have for them not to have to travel, that's pretty cool.
I'm still looking for the workshop that the location that has a good popcorn maker. Do you have that, Doug?
No, but I'll ask Gavin if he can provide one.
Yeah, sorry, Jeff, not a big fan of popcorn, but I wanted to emphasize that what this journey has been. The Cleaning for Health curriculum based on Dr. Michael Berry's Cleaning for Health book. Really, it's a textbook that was written 30 years ago, 1993. We used that book from Dr. Michael Berry in a workshop in November 2022 at the Normie Academy to train 20 master trainers, but also to develop and update the curriculum. So we spent 10 days developing new curriculum that we then presented to the US Department of Labor at the federal government level. They went through and reviewed it and told us it was approved. Since then, in this year alone, our partnership, the work we've done together, we've now just this morning completed our 40th workshop. That's over 720 people trained in just under 9 months.
Yeah, that's amazing.
And the feedback we're getting from the 720 people that we've trained in a face-to-face environment, like at the Normie Pro Academy in Sunrise, Florida, was that they haven't had any training in the last 5 years. 87% of everyone that's come to our workshop, that's a big number, have not had any training in the last 5 years. And as Doug said, what makes this training center special, it's all hands-on. But what that means for me, adults learn by doing. And if you learn, so this morning's workshop, we just finished a 3-hour Cleaning for Health workshop here in Lake Worth, Florida. And it wasn't about how to clean, it was about why to clean. The Cleaning for Health workshop, the introduction to our program, is why do we clean based on reservoirs of germs from people, as well as reservoirs of germs in the environment. And that was brand new information to everyone who attended today. We had such a fantastic morning.
And everyone stayed awake, alert.
So far. So the exciting thing about this to me is that we hear this so often that someone's been in the industry for a really long time. They've not heard this information before. I think Gavin is bringing to the table the science behind why we do what we do. And that's just, for a lot of these guys, new information. So it's fun to see their excitement and to tell us after this kind of event, this is the best training I've ever had. So it's really cool. That was really fun this morning.
Thank you. Can you talk to maybe the requirements that people have for training, the need for that you're fulfilling? Licensing or governmental requirements, or maybe to get a contract for cleaning. Does that fit into this?
Well, I can tell you on our side for the mold remediators and mold assessors, of course, we're an approved training provider for all of the states that require licensing. And, they've never thought about themselves as cleaners. But the truth is they are. That's exactly what they do. And you've got to remove the contaminants, microbial growth, before you really do anything else in a remediation project. So I think being able to bring this kind of training to them is really, really neat. And it allows them to I think, kind of ramp it up a little bit in terms of the way they see themselves. We've talked a lot about this idea of making sure that these guys feel like they're essential, because they are. And when you talk to remediators and sanitizing companies and restoration companies and are able to show them this is a side of the industry that you can specialize in, I think that's really exciting.
It is. And I found that interesting that restoration people don't realize that they're also cleaners, because isn't that what it is? It's you're cleaning. You may be doing some construction as well, but you're cleaning. So
yeah, that's exactly right. During the COVID outbreak, one of the things that we pivoted toward was a certified sanitizing professional. And the purpose for that was that we wanted our guys to understand what we've always said. Mold is just a surrogate for other types of microbes, and you are actually in the microbial business. When you use some kind of sanitization protocol to remove mold, you're also removing bacteria and other types of microbes. So it's just, I think, a great addition to what we're doing.
So, Gavin, there's lots of training centers in the country, around the world. We need more. I think that's your angle. This is our second interview about a new training center. Why? Why do we need more? What's going on?
Great question, Jeff. Really important. And we've used this term, essential cleaning profession. What makes anyone, electrician, a plumber, a builder, anyone that does a trade, and cleaning is a trade, be recognised by federal and state government, insurance companies, for example, and just facility managers across the country, around the world. It's training, it's education, it's workforce development. And it's so important that we look at, if you're going to clean for health, not just for appearance or smell. That was a long time ago. It's now clean for health. You use best industry practices, science and evidence that comes through training and education. But more importantly, Jeff, it's recognition. So the ISSA Cleaning for Health curriculum, the courses, has been reviewed and approved by the US Department of Labor. What in our alliance, again, ISSA has an alliance partnership with NORMI. What Doug has done down here is worked with the state government. The Florida state government has now received both our workshop, our face-to-face workshop, as well as our online material, and they've peer-reviewed it, and they've now said, we now approve the Cleaning for Health workshop curriculum for both face-to-face and online for workforce development in the state of Florida. Every state in the country has workforce development programs, but more importantly, they don't do it for the cleaning industry. And as we found this morning, everyone that attended the course today haven't had any training in the last 5 years. They would love to get training, but it's not here how to use a piece of microfiber or how to use a mop or how to use a vacuum cleaner. They want to know the why. Why is it so important to create indoor spaces, safe and healthy? Because you and I know, Jeff, everyone spends about 90% of their life in an indoor space. And if you live to the age of 80, Jeff, that's 72 years indoors. Wouldn't you like that to be health and safe?
I think so. I would agree with that. So Gavin, what's next on your agenda for more training centers? If someone says, hey, I've got a good classroom, I'd like to be part of this, what should they do?
Well, within the GBAC Staff Facility Accreditation Program, it's a continuous improvement program, Jeff. It's no pass or fail. First of all, you've got to tell us how you clean. Your cleaning story. What tools, what equipment, what products, with what chemistry do you use on different services in different areas? How do you measure that? How do you implement that? How do you do that in a way that creates a safe indoor space? We start that as the baseline, and then we put them on a continuous improvement program. And so what we did with NORMI, and I said, Doug, you bring in all these people into the NORMI Pro Academy, they leave. We do it. We measured it, it works. We used our ATP meters, we used our UV black lights, we used our indoor air quality monitors to monitor the cleaning process, and we created a healthy indoor space for the next class. And it's a simple process. People know how to do it, they just don't know how to tell the story, Jeff. And the GBAC Star accreditation process is about telling the story, science, evidence-based. You get the accreditation, and then you keep improving. And so it's so important. We want to see a network of training centers in the US, around the world, that teach standardized, approved curriculum. And now we've got our Cleaning for Health workshop approved by federal government as well as in our state government.
So one of the things that I found, if I could say this, Jeff, one of the things that I found that's so neat about this accreditation is that you can know what to do, but you can't teach what to do unless you do it. And I think that's what we're trying to do, is we're trying to say, look, you come to our facility, we know how to clean, so we can intelligently talk to you about how to do it in your environment. And it just makes sense.
All right, you both can chime in on this question. What's coming up in the future, in the short term and the long term?
Well, I'll just tell you that we have big plans. NORMI has big plans this next year, 2024, to expand out to the West Coast. We've already talked with some folks and trained some folks in the UK. Interesting thing is we find out that the only people who need solutions are people who breathe. So we're really excited about being able to do our training out across the country and to expand that way. Part of that's going to be our effort at the ISSA conference to have a booth there and start talking to folks in other parts of the country.
Yeah, so Jeff, at the ISSA show in Las Vegas, November 14th, Tuesday, we have a free 3-hour Cleaning for Health workshop in English and also a free 3-hour Cleaning for Health workshop in Spanish. And Normie's providing the instructors for the Spanish course. And it's so important. We've had the Cleaning for Health workshops now translated into 8 languages. As Doug said, we're looking for Haitian Creole instructors. Are we going to find them? You bet you we are. We just got to look hard, but we're going to find them. So what we're going to ensure that the training material that ISA has, Normie has, is available for every essential cleaning professional. This is probably over 6 million people in the US alone. And that we put them on a pathway of continuing education, workforce development, but more importantly, we make them feel that they are essential. We make sure the government realizes they're essential. That's the next step. So 2024, Doug and I and many of the other people that we work with, there's about 20 of us in the team, have come up with curriculum, dates, times for workshops. We're going to publish that soon. But we're so rich in training material, we're just going to put it into a program that helps people.
There's one thing I know for sure from this conversation. There's no vacation for either one of you for a long time. So get back to work, and thank you for this today.
Thank you, Jeff.
Thanks, Jeff.
We're going to get started here with Skip. And Skip, I want to welcome you. And for the people that don't know you, you've taken quite a few of our courses. We've actually met down in Mexico. You joined us down there for some training. That was an interesting boat ride we had too. It was a really good time. And I'm glad that you're here with us tonight. And I'm really glad that you followed through with becoming a Normie Pro like you said you were going to. So if you could just tell us a little bit about yourself and what your interest was in at least starting the process of becoming a Normie Pro.
Yeah, thanks, Lance. That was a fantastic educational forum in Mexico. And yes, we did have a lot of fun on the boat.
Yes.
I guess from more of an overview, many years ago, I talked to my wife and I said, we really need to get into the mold industry. And it was like, why? I said, because it's not comprehensive. They're missing key points. The reason I brought that up was because I have over 2 decades of experience in healthcare, medical diagnostics, and I have a kind of unique perspective, at least I thought I did until I met more Normie members, on the microbial landscape, and had too much crossing paths with people who had traditional remediation and they were either sick or not and so on. It just spurred my interest on that. And then that it was put on the back burner. I'm going back 10 years. Then COVID hits in 2019, I think it was. And I was driving on the 101, we're located out here in Santa Barbara. And I saw a plumbing truck go by, and they had a banner on there that they obviously had made up very quickly. It said, "We kill COVID." Okay, that's it. So I'm taking a very different approach to this from infectious disease in that implantable and or sterilization and maximally reduce things that can make you sick, right? Heart valves, you have to be sterilized. They can't create health problems. They're supposed to solve them. And so I started looking and was certified by a different entity as a remediator and assessor, and got my feet wet and started learning and got into a little bit of IICRC training. And then through my company affiliation was introduced to Normie. And this is going back now, 2 years anyway, 2 to 3 years, I believe. And I was fascinated by the breadth and depth of knowledge on this very thing that I was seeking. And I just couldn't get enough. I just could not get enough. And of course, I went down the CMA, CMR, and it was the most comprehensive class with the instructors were consummate professionals, and the type of information and the way it was laid out. I mean, I was just soaking it up. And then as I learned more about Normie itself, its history, recently, right? This July was 20 years anniversary, and I started to look at the breadth and depth of other types of programs. That led me to going to the conference in Mexico, and then shortly thereafter, I went to Florida for the NCRSI, NCMP.
Hey,
And
Skip, let me stop you for 1 second, because we're throwing a lot of initials out there, and there's people watching that may not know what you're talking about, like the NCRSI. It's the Normie certification for sensitized individuals, actually for remediators for sensitized individuals, or the the NCMP, certified mold professional or microbial professional. And it's a different look, like you said, at the industry, and I'm glad that you had brought that up. And because of your background from the medical side, you see the value in not just giving patients, here's your medicine, go back to your contaminated environment. And obviously we can't fix people, we fix houses, and that's what the medical side is missing. So I just wanted to bring that back to, I think it's such an important point, and you picked on that, and that was really something that everybody really needs to consider if they're doing this business.
Yeah, no, thank you for setting me straight on that. My apologies to the audience. These acronyms were difficult enough for me to remember, and now I tend to cite them rather than their full trade name, right? But here's the difference. I was fortunate enough to, we've been hiring some additional technicians, and they're getting their CMA, CMR through Normie, and they will be taking additional classes, one of which has 16 years experience in the industry, more so on the water damage abatement side, but with 2 different companies in various parts of the state of California. And as we started talking about the things that Normie talks about, I would ask, have you ever had these discussions before? Were these any of these topics, things that you would be talking about on a daily basis, either internally with the businesses that you were representing or with your respective clients? And the answer was no. Nobody wants to talk about this stuff. This is about water. It's about drying it out. It's about demolition, and it's about reconstructing and getting a PRV that passes. And so I know that I'm on the right path. I know we were on the right path, and I know I am absolutely aligned with an organization that is at the forefront of this. And through our conversations, since I've got to know you, and certainly with Doug and others at Normie, this whole IAQ, which is what this is, right? This is an indoor air quality, because invariably, no matter what the water intrusion event, whether it's the catastrophic occurrences in Florida, most recently with the 2 hurricanes and tornadoes, or a water heater leak, it doesn't matter what it is, a water damaged building invariably, rather quickly, becomes a toxic environment from the quality of the air that occupant is breathing. And a preponderance of the industry that I know of, not everyone, does not recognize that. And the indoor air quality aspect within this very large industry, I think, is going to grow in leaps and bounds with its awareness. It's not just what's wet on a wall, it's what are you breathing as a result of that getting wet. And that's critical.
Well, one of the things that, you and I have talked about is, you mentioned this is all IAQ, indoor air quality. Well, a lot of the companies that are out there, or most of them, doing all this type of work, forget that they're under the umbrella of indoor air quality. Whether they're plumbers, carpenters, electricians, whatever they're doing has some kind of effect on the indoor air quality, but they don't go to that next level. And that's what you've recognized, and that's what we talk about.
Yeah, when I meet with a client, any of my technicians meet with someone, or even if it's a phone call, I have a mold problem. I said, well, what about specifically? And then we start talking. We have a line of questions, very simple, very, very, very fundamental. Why are you calling? How long have you lasted? And where's the water damage? Right. And so through our inspections in our preliminary IAQ diagnostics, air testing, right, and I'm not going to go down that pathway right now. What we hear invariably, and this is fundamental, I think, not because of my background, but the normie trained professional is sharing this information, is sharing their knowledge, knows the type of questions to ask. And invariably, we get 100% of the time. I have spoken to 2 or 3 other companies. They have no clue what I'm talking about. That's even a larger issue, not to jump from this subject, when we talk about someone who's confirmed as a SIRS diagnostics or diagnosed with SIRS, chronic inflammatory response syndrome. But just the general basis, the general public is doing their due diligence before they call us when they have a problem. They know it's an indoor air quality problem. They know it's a moisture problem, but it all comes back down to building science and then building performance enhancements. So as a normie professional and now having this normie pro designation, I've said it all the time. I tell my technicians, the responsibility falls on you and you alone to be as good or consummate subject matter expert as you possibly can, because somebody is asking for information and we need to give them the correct information, and then the fact that we can solve the problem comprehensively. And normie's the only one who talks about it. It's the pole position, and I've said this for 2 years. I think normie should own that pulpit as the indoor air quality authority within this industry.
Well, you just went through the process of becoming a normie pro. And I think you had to take a step back and think about all the things that we required. And did that surprise you at all, what we were looking for?
No, not at all. Not since I met you and learned how you operate, and certainly in meeting Doug and Tim and others that were at the conference, I would consider industry colleagues. The breadth and depth of knowledge, absolutely not. The normie track is, and now let me just say this, right? Because I do believe that this is relevant for the audience. I'm operating in California. California does not have any laws associated with mold assessing or mold remediation. There are companies out here that environmental testing companies that are providing, air spore trap, culturable, VOC testing, et cetera, but they're also writing, they're authoring mold assessment reports and dictating what the remediation should be, and they have no certifications, none whatsoever. There are other, and I can cite 2 right in the within 10 miles of my office, and so when you see that happening, the analogy I come up with, and I talk to people who share those reports. I need feedback. I want a second opinion. And you look at it and it's not complete, not comprehensive, not this, not that, devoid of know this, know that. Source identification wasn't existing, and yet they're telling somebody they've got to spend thousands of dollars. Hey, there's a problem there. And so part of this is, and I'm not trying to be degrading of anybody trying to earn a good living and trying to help our fellow human beings. But you'd like, with something that's so important, that the person coming in working on your home in this environment, to at least had some type of certifications. Like you go to the doctor, my knee hurts. Well, would you like your orthopedic surgeon to at least gone to med school, right, to know these things? And that's where I'm going to build that bridge. we're not talking about rudimentary type information that Normie is training people with. It is the latest science. And I've said this recently, if the general public knew what Normie is sharing through their training program, if this decades of tens of thousands of peer-reviewed published scientific literature, if it were published in Sports Illustrated, right, People Magazine, Better Homes and Garden, every one of our phones would be ringing off the wall because it is an absolute epidemic in and of itself.
Let me ask you something on a more positive note.
I'm not trying to be a downer here.
Oh, no, and I appreciate what you're saying, but I really want to focus a little bit more on you. All right. I'm going to have Doug come in here in a few minutes too, and I'm sure he's got a bunch of questions and things he wants to talk about. But I think, oh, you just derailed me with that last statement. You know, it's all about you doing the Normie Pro path, and what is that going to do for your business in your mind, in your planning going forward, if it already hasn't started doing something? That's what I'd like to hear going forward.
Okay, well, you know, I'm a there's no I in team guy here, right? So this is I am one of the I am one of the Normie professionals that has an oar to pull. And that's how I look at it. But to answer your question specifically, the legitimacy, right, of what I say is now backed by a national, highly regarded and respected entity, period. And I use that, right? And I've actually got some areas on my webpage where I'm promoting who is Normie and why is it important. We tell people here that, you know, you can go to the California Department of Health in their question and answer page. Again, no laws, but if you need help assessing or remediating, who do you call? And the first one mentioned is Normie. So it gives credibility. And it's the accuracy and volume of information. So when I tell people I'm Normie certified, they don't know what that means. I said, go, and I tell them, go look it up. I want you to look, you can't have this type of a business relationship with someone you don't like, first of all. And secondly, you don't trust. You're entrusting me to solve a microscopic problem that is causing illness within your family. You need to understand that I am very uniquely qualified and capable. The deliverable differentials that we present is unlike anything any other company out here, and that's true. So it does allow me to go down that pathway and say, you know, on the old school stuff, feature benefit. In dealing with us, you get this. In dealing with us, you get this. In dealing with us, you get this. And it does make a difference, and it does matter. The problem that I think we are all faced with, and I'm no different, is this is a educational program. It's creating awareness within the masses, and that's the challenge.
The term that we are constantly using, and this comes from Dr. Gavin McGregor Skinner, is follow the science.
Yeah.
And that's really what we are trying to do. And the Normie Pro level of training and certification or designation is people that we feel have reached the amount of training, expertise, knowledge, have the right disposition to work in this industry. And that's where you are. So congratulations on that. Doug, I see you've come in the room.
Yes, I have. I just think one of the exciting things to me is to have people like Skip who are really committed to helping folks the right way. I think there are a lot of people out there in the marketplace that maybe think they know what they're doing, but really don't. I think it's wonderful for us. It's always been kind of a dream of mine since we started Normie to have an army of people out there doing what we're capable of doing, but our arms are not that long. We need a bunch of people out there that are telling the story. And we said from the very beginning that we're in the education business. It's not just about educating professionals, it's about educating professionals and teaching them how to educate their clients. And sometimes that means taking the time spending the energy involved in being able to sit down with the client and tell them exactly what you're going to do. And I think that's one of the things that Skip has brought to the table. That's why I'm so proud to be able to have him as one of our Normie pros. He's going to be in the marketplace fixing what a lot of other people don't even know how to begin to fix. And so thank you, Skip, for your commitment, not just to us. I mean, that obviously is very flattering, but more importantly is your commitment to doing what's right. And I just really appreciate that.
Well, you're very welcome. I mean, it's a joy. I mean, this is a very humbling experience for me. It was a very robust experience that, you know, at this point in time in my life, I didn't know that I had to turn my brain on and go study stuff. But it needs to be. It has to be. Not foolishly ridiculous, like trying to get an insurance license where they make it so confusing that they don't want so many people to have an insurance license. This is about relevant, very critical information. And you know, it has to be stout and it has to be robust. But, you know, back to the science that you bring, well, Doug, you've sat through one of my educational presentations. It's very heavily laden with some of this decades-long scientific peer-reviewed published articles. And you just let people know that this is what happens. This is what happens in an environment. And this is what we've known, not since, you know, 2017. We've known it since 1990, 1995. And yet the industry does not pay the type of attention that it should. We know this, right? And so, and those of us who are knowledgeable about this, we can tell by looking at an air sample result. I know you do it, and I know Lance would do it, and Tim can do it, and there's many people on here that can do it. But how nice would it be? Well, how would that change your business if you could look at an air spore trap result and be able to tell somebody you had a major water event here, most likely recently. And I do that. And they go, how did you know that? Right? And because to properly diagnose the building establishes the framework for creating the sequences of either remediation, abatement, and or sanitization, and reversing the microbial contamination. Therefore, that environment now supports wellness as opposed to being a most likely contributing source to human illness. And it's really cool to be able to do that.
Yeah. So Skip, we have a lot of people in the room tonight that obviously, but I think we have a bigger audience that are going to watch this on our TV channel. And I'm curious as to how you feel, or how would we go about letting our Normie members understand the power of what's in this higher level education, this advanced education, which leads to the Normie Pro designation. And the reason I'm asking that is, you're right, we're celebrating our 20th year. We have some folks, I got to tell you, we have some folks that came in 18, 19, 20 years ago and never taken another course.
Yeah.
You know, and I mean, you know, that's going to be the case. What do they say? 20% of the people do 80% of the work. And there's always going to be a small percentage of people who really feel the same tug that you feel and that I feel and that Lance feels about being able to help the clients in a different sort of way, and confident enough to know that they're willing to pay for it. I don't have to, you know, compete with people who are giving stuff away. So I'm just curious, you know, here's a platform for you. How would you tell these Normie members that have maybe been around 2 years, 6 years, 10 years, that this is really a step they need to seriously consider?
Yeah, I would lead with the following, which is the basis of our business out here in Santa Barbara, California. Since we started, I would say that 30 to 40% of our population, of people who call us and we ultimately end up doing work for, are being treated by a doctor, are confirmed to be mold sensitized, and or some of them are very, very sick and are subsequently diagnosed with SEERS. that's how this business has taken off. And people are beginning to realize that, I mean, we've got county employees now that are telling other county buildings that this is the company you need. This is the company you need. So I look at this, and here's the bridge that I'm building, right? If you look at the sensitized individual, the percent of the population that has a susceptibility to mold, it's tens of thousands of people within this audience and the normie family or normie membership who will watch this at another time. In any given part of the country, tens of thousands of people need you to be the subject matter authority. They have an environment that's contaminated, whether that's a hotel, their home or apartment, or their school, or their office. EPA, 50% of the buildings are contaminated, right? What gets you the ticket to the dance? I happen to think it's the normie certification, right? Because we know what we're talking about. It's becoming that subject matter expert. And then 30% of the population, my goodness, 30% of the population out here in Santa Barbara, as an example, I may be a little bit lofty, but if I include the 20% that has a genetic predisposition, right? And then we look at the SEERs, or what we know to be, vis-a-vis, somewhere around 30% of the population. That's 60 years of work for us. Right. With a subset of the population that is, in many cases, at their wits' end. The amount of depression and so on and so forth is just almost incomprehensible. So, in business, I've been in business a long time. You've been in business a long time. Lance has been in business a long time. So what's the low-hanging fruit? It just so happens it's the most challenging because nobody wants to deal with it. And nobody has the capacity and capability to deal with it. So therefore, normie gets you this spotlight put on you. This is somebody who really knows what they're talking about. They can help. That's devoid in this industry out here. It's devoid.
Hey, Skip, there's a separation in the industry that's happening, and it's starting to gain momentum. People in this industry have always been cleaning for appearance.
Right.
Now it's starting to come across that people understand cleaning for health is different than cleaning for appearance.
Right.
Again, Dr. Gavin talks about this a lot, and I'm using his words here, but he talks about, if you look at an airliner, the 150, 200 seats on there, Doug, what was it? They give him 9 minutes to clean the plane.
Yeah,
the best you can do is fold the safety belts.
Yeah.
That's cleaning for appearance. It's not cleaning for health. And that's what the whole Normie Pro concept is. It's doing it the right way for the right reasons.
Yeah, somebody who's pretty smart and wise typically will say, if you do the right thing, people notice. So that's you up there in the top left-hand corner of the screen. And that's what normie is to me. I could not be, there is no other certifying entity that is talking about this, that wants to do it right, who has the breadth of knowledge, who trains people to do it right. And look, we're overlooking many aspects of this, right? We're many aspects, but you have to understand the microbial landscape and the interaction, in that indoor environment. And yeah, every time we fly on a plane, it's like the seat is in a biosafety cabinet with an infectious disease sitting over there in the corner of the cabinet. I mean, it's really crazy. And it is a building science issue. It's all of those things, and water is the thing that turns everything on.
So I have another question for you, Skip, and this is maybe a little bit off the subject, but I'm curious to hear your comments about this. And I know a good lawyer should never ask a question that they don't know the answer to, but frankly, I don't know the answer to this question, so I'm going to ask you. We have a lot of our members, especially the new guys that come in, who think that their business should be built around insurance and insurance companies and insurance payouts. And I'm just curious if you would share with us what percentage of your business is actually paid for by insurance companies?
Less than 1%.
Yeah, so I've been preaching that for a really long time, and thank you for answering that question. And I couldn't have written it better. But I've been preaching that for a really long time. That we sometimes, unfortunately, in the restoration and remediation, even in the assessment business, we tend to feel like we've got to be working with insurance companies, and we just don't. People, I've said it for years, and I think you'll agree to this. People buy what they want. And so if they feel like there's something that's going to improve their health or going to improve their family's health, that's what they want because of their love for their kids, because of their love for their wife or their husband. That's what they want. They're going to figure out a way to pay for it. And they're not going to wait around for Allstate or Farmers or somebody else to write them a check.
Couldn't agree with you more. And here's what Normie does for that person. We are uniquely showing them the microbial profile within their environment. We've identified their moisture content. We have the presence of beta glucans. We have the presence of actinobacteria. We have marker molds. We have total particulate in the indoor environment. And then we've explained to them in a very simple, easy to digest, that everything that's going on there is in their lungs and then in their bloodstream. What we are the solution at that point in time, because when they talk to other people, they're not getting that. In fact, they can't even go to a healthcare practitioner half the time that understands what's going on for them within their body. Now, we don't talk about that, the health part. We make recommendations, but we talk about cause effect, right? And this is environmental, and it's air. And I'll say it again. It's why I'm so closely aligned to you guys, to this fascinatingly capable organization. Because if it's on the surface, it gets in the air, it goes back on the surface, it gets back in the air, and it always ends up in your lung. Period, end of story. And that's what causes the problem. And that's up to the doctors to dot that I and cross that T. But we bring them to that point where they deduce that on their own, and they have no other option to have that problem solved.
Well, and as you suggested, I think the whole concept that we've really tried to push hard, especially probably in the last 6 or 7 years, this idea of the microbial load. You think in terms of endotoxins, actinos, and what kind of testing you're going to do, mycotoxin testing, hurts me. What is an ERMI test? What does it mean? What does it do? What does it not do? Those kinds of questions at that higher level, I think, unfortunately, a lot of our members don't realize the value of that. But, there's a lot of people that are suffering out there with symptoms that look like mold that's not mold. And one of the things that I think that we've been really excited about the last few years as we've taught this in our NCRSI class for sensitized individuals is putting together a team, including their doctor, to be able to identify what things they're actually looking for. And it may not even be mold. I think I've told the story before when I was asked to go out they thought they had a mold problem. They didn't have a mold problem. They had a MRSA problem. Well, how did I find that? Because when we do an assessment, we don't just do mold, we do bacteria, we do VOCs. And the point is that, as you've said, and I think correctly so, when you have that broader view, there's a lot more people you can help. And it's not just a matter of saying, well, it's not mold, see ya. It's having the ability to be able to go deeper.
Yeah, absolutely. I think what we're going to see here is more of a SWOT approach, right? That there's going to be within that dynamic. And of course, the Normie certification class for the sensitized individual, we're already looking at a very, very massive amount of integers affecting that family. I'm dealing with one in Los Angeles now. 10 years ago, they spent $200,000. They ripped everything out of the house. They couldn't live there. They moved to an apartment at this gentleman's estate, lived on his balcony for 5 years until they found a home before they moved into a house. They spent another $200,000 ripping everything down to and he started getting sick again. right? And it's not just mold. So you have the healthcare practitioner who's dealing with the patient. You have us that's dealing with our patient, the building. Then you have separate sets of expertise. The lungs of the building is the HVAC system, if they have one. Then you need somebody who's very competent and knowledgeable and patient enough to deal with detoxification. Sometimes that's not the same doctor. Then you have a nutritionalist who specialize in mold detoxification and nutrition. So it's going to take that team approach, and it's a collaboration. And I tell people up front, this is going to be a collaboration. I need to work with your doctor. I need to work with your detoxification expert if they have one or don't. And we are going to work on this together, much like when you go into an operating room to have a knee replacement, you have an anesthesiologist, you have someone who's assisting the doctor, you have the surgeon, you have the this, but long before that, you had the team that came in and sanitized and decontaminated. And after the procedure, you've got the intensive care unit for recovery. That's what this takes, because it's that involved. These are very, very microbially toxic environments.
Yeah, that's exactly right. And you just gave me a good transition. One of the things that we started doing last month, and a lot of people don't even know this, we got some advertising out on it, but not a lot. We took all of our building science courses and bundled them into a really great price where you can take these building science courses and understand insulation and air movement and HVAC. And anybody that's listening, if they're interested, they can call, and we'd be glad to give them that number, that coupon code for that particular class. But that's, again, taking a broader view, as you said, a broader view of that environment rather than just going in and taking a couple of swabs. I was telling somebody just yesterday, I had a conversation with someone just yesterday about this, and they were concerned about, am I going to have to spend $20,000 on testing? And I said, well, do you remember, I'm old enough to remember when you took your car in, the first thing they did was change to the points and plugs.
Yeah.
If that didn't work, then you took the next step. If that didn't take you, you took the next step. Now, of course, they plug in a computer and they figure out what the problem is right away. But my point is that really is the way we approach it, almost incrementally, is that what we're doing is eliminating possible problems.
Yes.
And so sometimes that is a step-by-step process. It's not necessarily going in and taking all the tests you could possibly take, in 2 days and then dumping all of that on the client. So again, that's part of that is from the training process, understanding how it is that you can approach this, where a customer can actually afford it, but you can get the information you need to help them and their doctor figure out what's going on in their environment.
Yeah, it's very sequential. I'm glad you brought that up. There's a reason why you are who you are. We look at this very methodically, and we line a bunch of dominoes up. And this is another part of the conversation I talked to with our clientele. Look, the dominoes are all aligned or in position to be lined up. What we need to do is identify rationale for doing anything first and foremost. And once we get a keen understanding of what's going on, then we've positioned those and we just go tick, right? Because understanding what caused the problem, having perfect clarity on what the problem is, dictates the sequences necessary to abate the problem and create an environment that no longer is going to be toxic. And then it becomes a maintenance game. It's no different than, again, this is, look, I could talk about this for days and I'm so passionate about it. It's the working with you all and everybody out there who I can't see right now is the closest thing to when I was working in the healthcare field. Because we all know this, that it's about testing, it's about process, it's about procedure, it's about continuity and consistency, it's about never thinking you've got all the answers, that you have to go into every environment with an open mind, because what you think could have been the problem isn't. It may have been a contributory factor, but it wasn't necessarily primary. It's no different than trying to understand why somebody doesn't feel well, right? And the first thing is the blood pressure cuff, then it's the stethoscope, and then it's, well, you still, okay, maybe we need an x-ray. At what point in time do you order a Chem 20? when you need to order the Chem 20 based upon what the information is telling you you need to do. But it's all data driven, right? It's all data driven. And that's another thing that Normie does. It's data driven. Now, yeah, there's an expense to it, and we want to minimize that. And I tell people all the time, my job is to solve this problem without you having to pull any more funds out of your bank account than necessary. And I promise that that will occur. And if I tell you you need to make a withdrawal, there's a good reason for it, and you'll know why. If I tell you don't need to, there's a reason why, and you'll have the data that suggests that you don't need to make that withdrawal, because this is about doing the right thing, right? And so it just makes it so. It's so unique. It's, again, Normie is the PhD. Normie Pro is a PhD, and I have a lot to learn. And I am so very glad that I did take that building science class when it was bundled, because I thought I knew some stuff. And I was able to use many aspects of each of those classes, most recently at a resort in our general vicinity, and told them that they have a building problem. Structurally, it was built in 1908. And this is why you're having these problems. And I was able to educate them and say, let's take a look at how the building was built. What are the problems? This is why you're having these problems. And so you start doing investigating, and all of a sudden you've got credibility, you've got data. Here it is. What do you need to know? And nobody else does this. No other company does it. Everybody is not questioning hearts, not questioning business ethics. But this, we now know, science has showed this, the peer-reviewed studies for decades. This is a major problem. And most of the remediators, most of the company people that are in this business are only scratching the surface. That's why, for example, again, not being disrespectful, but most of the time, most companies fail a PRV 60, 70% of the time in the first shot. Most of the mold goes back because you didn't properly identify all areas of the building that had a water problem. And so you've got this knock against, those of us in this industry. I spent $200,000, mold came back, and I just hired some other company, and I hired some other company, and we're still sick. Well, that goes away with a Normie trained and professional, competent, caring human being.
Well, and I think that's the beautiful thing about what we do when we do it right. You don't want to hear back from the customer that the problem's back. And when you take this holistic approach, I think that's really the answer. Of course, that's why we always call this a solution-based assessment, which is really looking at the end goal. The end goal is we're going to create a cleaner, safer, healthier environment. We're going to do the best we can with your building. That may not be the reason why you're having the issues, but at least we can say that the building is as clean as we can get it. And I know you've done some phenomenal jobs. That's why, again, I'm really very proud to have you as a Normie Pro. I understand you get zeros every now and then in terms of any kind of growth at all when you're through with a project. And I think that's pretty impressive.
Yeah, I wanted to learn, I think I've used this analogy. You go to the dermatologist, you got something on your cheek, they take it out, right? Well, the pathology report, which is what our PRV is the pathology report. There's nothing in there. We got it all. And so it's a change. You know that. We've been talking about how do we interject a different standard of care as an end result. But that's what we do. And it's reassuring, it's reproducible, and it should be, certainly for the sensitized individual, the new standard of care.
Well, I'm going to turn it over to Lance. I just want to tell you how much I appreciate you being here, Skip. I know we're winding down, but you know how much I appreciate you and the work that you're doing and the relationship that we have. It's great. Thank you so much for being so committed to what we're trying to accomplish.
Yeah, I just want to figure out what the secret handshake is now.
No.
I don't know what that is.
No, you got to be part of the environmental task force for that. We've talked about that, and we're going to get you involved.
All right.
All right. Well, no, Skip, I want to echo Doug's comments and thank you for being part of this. We think you're a big asset as a Normie Pro to this industry and to us. We appreciate that. So
Yeah.
if you can hear.
Yeah, no, my pleasure. Proud to be here, proud to drive, be part of this boat. I'm pulling on my end of the oar. I'm talking about Normie as often as I can. It makes a big difference. You gotta have people who know what they're talking about. See, simple. That's the simple part of it.
Well, we appreciate you spending the time here with us. We know you're 3 hours behind me here on the East Coast, and it's the end of your work day, and I guess I'm a little bit early for my next work day, but here we are. So I appreciate that. I'm just looking to see if there's any other comments that may have popped in the room here.
Yep.
Just some thank you, things like that are coming through for you now. So absolutely, we appreciate it, and it appears that the people listening did also. So thank you.
Oh, you're very welcome. My pleasure.
For the rest of you out there, if you are interested in becoming a Normie Pro, I'm going to bring up a screen real quick just to give you an idea of what you need to look for and how you get there to get the process started. Give me 1 second. Hopefully you can all see my screen. This is normie.org. And when you come to the main page at normie.org, you're going to see a blue tab over here on the left. You click on that. It's going to take you to a page that's going to show you different tracks that you're able to go down for training and advancing your career in this industry. The one that you want to look at is Normie Pro, and it's a drop down. There's a few things that you need to look at. Obviously, all the information is here, things that are required and point values and how you get to the Normie Pro level. But the first thing to do is step one. This is request the Normie Pro status. Once you do that, it's like 2 or 3 questions. It puts you into the system. We're able to work with you and help you through the process, let you know what you need, what you don't need, and it goes from there. And at that point, there's other things you can look at here. You're more than welcome to click through this and see all the different groups of information that are out there. But this is where you start. Request Normie Pro status, click here. Takes you to a very simple page. A little bit of information gets filled out, and that gets the process started. So I would encourage you, if you have an interest in becoming a Normie Pro, that's where you go. Yes, Doug. Looks like your hand was raised. Maybe not.
I think that was unintentional. Sorry.
Okay.
Pushed the wrong button.
Telling me to be quiet. Okay, I got it. So, all right. Does anybody have any questions in the room? Anything you would want to ask Skip? Or any of us? Anything about the Normie Pro process or designation? Vincent, I'm interested in becoming a Normie Pro as well as service expert. Absolutely. I showed you where you go to start the process. That gets you into our system, and we will be in touch and help you through the process from there. All right. I do want to remind everybody that's in the room to please register your CEUs. We're on the new cycle now, so when this is over, you can go into normie.org if it hasn't popped up behind the screen, which it's supposed to, and just register your CEU for tonight. And that's something that you won't have to worry about later in the year, trying to remember when you attended training. That's all I got. Tim, Doug, anything else you want to bring up or mention? No?
Good.
All right. Well, again, thank you all for being here. We appreciate it. If you have any questions that you think of after we're done here, just go to support@normie.org or send an email to support@normie.org and we will get back to you, or give us a call during the day. And you may hear some new voices and names when you call in. We have some newer people working with us now, so reach out and say hello. Thank you all. Give me 1 moment. I want to shut down the recording here, and we'll be right back.
Hello, everyone. It's my pleasure to welcome to our program Dr. Gavin McGregor Skinner, Senior Director at ISSA.
Good morning, Jeff. How are you today?
Doing good. How about you?
Oh, doing great. Survived the snow this week.
Snow? Let's not even talk about the snow. We've got it here too. But we're here today to talk about how the news is out. The ISSA and EPA collaboration has created a buzz in the industry. We have the news online. We have an episode of Straight Talk that discusses this. Gavin's on that. And we have an article coming out in ISSA Today magazine. Sneak peek. There it is. Can't read it yet, though. But Gavin, we really got started with the video project that got the attention of the industry. Can you tell us about this, and are you surprised by the reception that you're hearing about right now?
Yeah, really important, Jeff. Very, very surprised at the reception from across the whole value chain of the clean industry. I want to emphasize, Jeff, there's a common goal. The common goal is to increase knowledge, demand, that's procurement, and use of cleaning products with safer ingredients like the Safer Choice labeled products. And yes, we started this by listening to 30 industry experts at the ISSA show. And what I've had recently is so many ISSA member organizations contact me or contact other ISSA staff saying, this aligns really well with our company values. How do we get involved?
Those that are asking the question you just mentioned, ISSA members, companies that should become members of ISSA, what is their role in this? Can you talk about that? Because that's the question they have. What can they do?
Yeah, so the first thing to do, Jeff, as we heard from our industry experts, 30 of them back at the ISSA show, everyone deserves protection from harmful effects of chemicals, cleaning products. That includes the workers who use the cleaning products, the employees in those buildings, and anyone who visits those buildings daily. So what I really wanted to emphasize for people to get involved, Jeff, right now, making safer choices is about collaboration. It's about strengthening new and existing partnerships. And we're creating a community through ISSA members. So to do that, we're asking organizations to sign a memorandum of understanding. And that memorandum of understanding is a formal, but it's a non-binding agreement between two parties, ISSA, the trade association, and our ISSA member organization. And then that memorandum of understanding, it will outline the roles and responsibilities and intentions for the collaboration. So again, I want to emphasize the MOU is not legally enforceable like a contract, but it helps us, ISSA and our ISSA members, understand each other's perspectives and how we work together for this common goal in 2025. And you can send me information. You can send an email to makingsaferchoices@issa.com if your company, your organization would like to sign a memorandum of understanding. And then what we then emphasize, Jeff, is that there are probably 4 key activities in 2025 that any ISSA member company can participate, can be part of, can collaborate with us after they sign that memorandum of understanding.
I like a plan, and that's a great start to this, Gavin. That's something that those watching should do right now. Send that email, get that document, get that signed. Talk about this, Gavin. How will this help the cleaning industry be data-driven and create healthier built environments? The big picture.
Yeah, okay, Jeff, this is good because the 4 activities that we're going to do that I want to outline in 2025 through our collaborative partnerships are going to create new information, new data. It's going to be that we're about to launch a survey of 1,000 facilities in Pennsylvania, New York, to ask the question, how do people make decisions on the procurement and use of cleaning products? In 2025, we're going to convene stakeholders and conduct focus group discussions and listen to their narratives of how they clean. That's our baseline. And we're going to learn about current knowledge, attitudes, and barriers to purchasing and using cleaning products. In 2025, we're also, Jeff, going to develop a playbook for the procurement and use of Safer Choice labeled products. So we know that many of our ISA members have resources for education and training. We're not reinventing the wheel here. We're providing access to a much larger audience. This is going to include, Jeff, also on-site product demonstrations. And then the 4th big activity we're going to do in 2025 is storytelling. Storytelling that involves persuasive narratives that show how people clean with cleaning products with safer ingredients and how to measure performance and how we've led to the increased demand, knowledge, use, procurement of EPA safer choice label products and other eco-label products. All that's going to create new data. It's going to ensure that the data that we collect, Jeff, is going to show that we can prove that we're creating healthier built environments.
I like it. Gavin, this program or this project right now, ISSA Making Safer Choices project, is about Pennsylvania and New York, correct?
Yes, it is, Jeff. Currently, we have funding from the federal government through the Environmental Protection Agency, the EPA, for $1.2 million for activities in Pennsylvania and New York. But we're also working with ISSA members, partners, stakeholders, again, the whole value chain on how we can take this project to other states here in the US.
Let's talk about that. What does that look like to you? Let's say a manufacturer's in Iowa and they want to be involved. Well, they're not in Pennsylvania, they're not in New York. What do you see happening with this eventually?
What I see eventually, and again, this is all proof that a trade association like ISSA can partner. We've partnered with two universities, the Penn State College of Medicine and the City University New York School of Medicine, to collaborate and develop successful activities that I've just outlined in Pennsylvania and New York. That's being federally government funded, but also non-government funding from ISSA member organizations can also contribute to those projects. Once we start learning on how to do the surveys, the focus groups, the on-site product demonstrations, we develop the playbook, Jeff, that shows how to procure and use cleaning products with safer ingredients. The next step, as we develop that, and we in the states of Pennsylvania and New York, we then take it to other states. That will require, again, effort, funding, support from our members, as well as support from the wider community. So again, this is a progression. It's a pathway, Jeff. We do what we do now in Pennsylvania, New York with the funds we have now, and then we're already planning now what comes next in those other states and who do we work with in those other states to make this successful.
Well, everyone watching this program right now, we're just getting started. I'm going to put some helpful links down below in the video description to the articles that we have online for this, the previous video, and of course, Gavin, the email that they need to reach out for that. What do you call it? The MOU?
It's the Memorandum of Understanding, Jeff. It's a formal non-binding agreement that identifies the roles, responsibilities, and intentions for a collaboration under our Making Safer Choice project here at ISSA.
So don't miss out, folks. Get involved with ISSA.
August 2005. It'll be a memory etched into the minds of those of us who lived through and survived Hurricane Katrina and Rita. As devastating as the 150 miles per hour winds were, no one could imagine the inconceivable costs in terms of loss of human life and property that the failure of the levees caused when it flooded nearly 1/3 of the city of New Orleans. With over 275,000 homes lost on the Gulf Coast as a result of the hurricane, 10 times as many as any other natural disaster in U.S. history, the city of New Orleans continues to deal with the results of homes flooded to the rooftop, unparalleled mold infestation, and potential health issues for the residents who remained to salvage what they could. Information and misinformation has been mixed together, and vulnerable property owners have been faced with the daunting task of trying to sort out the truth. And so the lessons are clear. Prepare when you can for whatever flooding might occur, not only for the potential, but for the aftermath. And whether a natural disaster or the result of someone's mistake, anyone and everyone can suffer the devastating effects of flooding. My name's Doug Hoffman, and I'm the Executive Director of NORMI, the National Organization of Remediators and Mold Inspectors. The information you're about to hear is designed to provide steps, guidance, and assistance for reacting to flood conditions in your structure. In most situations, a common reaction to a water flood event is to simply react and plan afterwards. Tunnel vision or over-focusing on the emergency can, at times, distract or omit safety concerns, and poor planning can leave you to fend for yourself after the storm is over. Caution and common sense should always be employed before any action takes place, and I hope this presentation will help you focus on the real issues both before the potential flood and consider the solutions available to you in the aftermath. Without a plan, the results of a water flood event will be worse than you've imagined, so there are several things I'm going to ask you to consider during these first few minutes we have together. The integrity of the structural systems may have been compromised depending on the nature and degree of the event. In all cases, if you are unsure of how to proceed or to create a safe environment to work in, contact a professional to assist you. A major concern in flooding situations are the utility services. Wet or submerged electrical devices, outlets, and wires can energize the area you're working in. The risk of electrical shock, burns, or even death must be eliminated before proceeding. This may require the power company to deactivate your service. And of course, natural gas and propane sources should also be protected, secured, or deactivated. This would include pilot lights, heat sources, and gas storage tanks. Depending on the severity of the water event, structural integrity should be considered in regards to the foundations. Foundation support could be weakened or damaged, allowing structural collapse. And with the utility and structural concerns addressed, the next major concern is the source of the water. Common sources of a water loss are as follows: a broken or leaking pipe from a drinkable water source, sewage or septic lines, groundwater, or a combination of those sources. And of course, you have to be concerned about the sewage and septic lines when you consider some of not only the sources, but the problems that could result after a flood. A general rule of thumb would be to consider any water that you would not drink as being contaminated. This would include water coming in contact with chemicals, human and animal waste, debris, and other unknowns. Protecting yourself is one of the important first steps post some water event. Exposing your skin, your eyes, your lungs, your nose, even your throat to contaminated water can create a wide range of health issues that may not appear for days after the exposure. I want to talk about personal protection equipment because that should be used while you're in the contaminated environment. Personal protection equipment can include a wide range of items, including boots, clothing, gloves, goggles, and even a mask. We recommend, under normal conditions, a N95 or dust mask that you can find pretty much anywhere. In some situations, the contamination levels are so high that you might even require a respirator. But each situation would require different types or combination of these types of protection. With safety and health concerns addressed, corrective action can then be taken. One of the most important things to consider with respect to corrective action is time. Time is your enemy. Once materials get wet or contaminated, damage and additional contamination growth is exponential. A clean water loss, if not corrected, can promote mold growth in as little as 24 to 48 hours. And contaminations due to sewage or unknown water sources will simply exacerbate the problem. Drying materials and surfaces in the least amount of time should be of the utmost urgency, and oftentimes power is not available, and so having a generator available will be a great source of power for some of the tools that you'll need to dry out the areas that have been flooded. Unfortunately, this may require removal and discarding of flooring materials, wallboard, and furniture. Many material and items can be salvaged depending on the contamination source, the time of exposure, the cost, treatment available, and resources. But a flood affecting a widespread area could reduce the available resources for that area. Not only do you not have electrical service, but you may not have access to floor fans or heaters or dehumidifiers or even an ozone machine that might help eliminate some of the potential contamination that you'll be dealing with after a flood. The following suggestions may not be appropriate in all situations. However, in all situations, safety must be the primary concern. Prior to or during a developing flood condition, remove any movable items, at least as many as you can, to higher ground and secure those locations if possible. Of course, the order in which those items should be removed is a personal decision, but things to consider are the cost of that item, the sentimental value, proximity to the flood, maybe the ability for it to be moved and the practicality of it. Removing items such as furniture and floor coverings prior to getting saturated will make the cleanup process, of course, much easier. Structural and decorative materials such as wallboard and carpeting are a major problem once they get wet. Most of these materials absorb moisture and can expand the damage beyond the water level. Wallboard and other materials such as pressboard or OSB-oriented strand board allow water to travel in an upward direction well above the water line. An example would be wallboard in as little as 1 inch of water can wick or draw moisture upward several feet. This also creates a problem inside the wall cavity which cannot be reached or cleaned. The rule of thumb is to remove the wallboard a foot to a foot and a half above the highest identified wet area of the wall. This will allow access for drying and cleaning building materials in the wall cavities. Up to this point, we've described different conditions, causes, and precautions. In the next section, we want to describe pre-planning and corrective measures. The preparation checklist. As mentioned earlier, safety is the most important issue to consider. You know, taking the important stuff with you is, of course, a great way to prepare for what may be coming. But what can you do to plan for the aftermath of the flooding? That must be considered too. Electrical and gas services must be secured before entering a flooded area. You know, as a side note, an improperly connected generator at a neighbor's home could energize service at your home even if the utility company has cut power in the area. This type of situation could cause an unknown and unexpected risk. With the utilities secured, standing and running water should also be avoided. The health effects from unknown contaminants against your skin is a concern in addition to the power of moving water. Did you know that just 6 inches of rushing water is capable of moving a parked vehicle? Losing your footing or being struck by debris, these are risks you need to consider. Assuming that the water is receding or the water source leak has been stopped, the next phase of the process can be started. Drying is one of the most important things you can do to reduce your loss. Contacting a remediation or drying company should be your first option. Pre-planning and contacting a restoration company before an imminent flood may place you on a response list if a wide area has been affected. Other options could include contacting the local fire department to have your basement or lower levels pumped out, renting pump equipment and generators prior to the flood while they're still available, and arranging for alternate lodging in the event your building becomes uninhabitable. Remember, the larger the area that's affected by the flood, the less resources will be available to you or your contractor. Here are a few internet resources for finding qualified contractors and some definitions we think you should know to protect yourself. NormiePro.com is a great resource for you to find certified mold assessors, inspectors, remediators, and other indoor air quality specialists, and you can find those certified contractors by your zip code. ServiceMagic.com is another great resource for construction contractors throughout the United States, and you can find them by the type of work they do and by your zip code. And then, of course, EnvironmentalExpert.com. To avoid being taken advantage of by a contractor during a flood emergency, understanding the following construction terms will be helpful. Licensed. In many parts of the country, having a license to do certain types of work is not necessarily a measure of that contractor's competency. Sometimes it simply means that they have government approval to work for a fee. Certified. Certification is often offered by certifying agencies, a specific organization that recognizes the skills, training, and the ability of the contractor who is certified. Being certified does not necessarily imply that the person certified is actually licensed to do the work. Insured. A contractor stating that they are insured is a pretty general term and could simply mean that they have auto insurance. Special types of insurance are required for specific types of work. For example, general liability insurance is not appropriate as coverage for mold remediation work. Qualified. A qualified contractor has been trained to perform certain types of work. However, they may not have the required insurances or licenses, or may not even be certified to do that work. The bottom line is that you need to understand the type of work that needs to be done, the capabilities of the contractor that you intend to hire, and then for your protection, have a written quote and description of the work to be performed. Make sure that the contractor that does the work is licensed by the municipality in which he's working, that he has the proper type of insurance, and request a certificate of insurance evidencing that specific type of insurance for the work he intends to do, and make sure that he's trained, either qualified or certified, to do the work for which you're hiring him. Keep in mind, using a contractor that's not appropriate for the work being performed may preclude you from any insurance claim, and you may give up your legal protection. If you cannot obtain a contractor, your only option may be to do the work yourself. With the decision to do the work on your own, we must stress that safety must be the main focus of your efforts to clean up after a flood. So let's talk about doing it yourself. While working in a safe environment, using the proper protective tools and equipment, water removal becomes the main priority. Pumps for pooling water and wet dry vacs provide a good start to remove the majority of water. Rugs and carpeting and padding, if saturated or contaminated by an unknown water source, should be removed to allow drying of the subflooring. Sheetrock or wallboard materials and insulation that have been submerged should be removed 12 to 18 inches above the highest wet area. As a hint, removing 4 feet of wallboard is easier to replace with a 4 foot by 8 foot sheet of material. It's easier to do that than to try to cut and fit in smaller pieces. Once the bulk of wet materials have been removed, air movement and turning on your air conditioner if the power is available should be provided. And this would include running the HVAC, heat or forced air systems, using dehumidifiers and fans to increase air movement, and applying sanitizers like ozone machines to help prevent mold and bacteria growth. Sanitizers are extremely important when dealing with sewage and water from unknown sources. Heat drying systems can also be used by trained professionals to dry the environment. However, improper use could result in fire or permanent damage to materials by drying them too quickly. Remember that the drying process may take several days to more than a week, depending on the extent of the exposure. Secondary or collateral damage may start to occur in that time. Mold and other microbial growth may start to appear on surfaces exposed to moisture or elevated humidity levels. And if you have a situation where you start to have large areas of microbial growth, the drying process in most cases was not done adequately or fast enough. There is available at enviroscreening.com, for instance, do-it-yourself testing kits to find out if the mold that's been growing in your environment is the type of mold that might need to be removed or dealt with differently than common molds. In this case, it's recommended that you seek the assistance of a professional mold inspector, a qualified sampling technician, or a remediator. Health concerns become additionally critical as the environment conditions deteriorate. In regards to mold licensing laws, there are currently only 4 states that have mold licensing laws in place. Texas and Louisiana, of course, have their mold licensing laws in place. Florida has their licensing law in place, but it doesn't go into effect until 2010. And then just this year, the state of Maryland put in place their mold licensing law. The important thing is that you check the qualification of the indoor air quality specialist or the mold inspector or the mold remediator or assessor in your state to make sure that they are licensed, certified, and insured before they begin any work. Let's talk about some common misconceptions and myths pertaining to flood and mold and indoor air quality. Oh, bleach kills mold. How many times have you heard that? Well, bleach is an effective sanitizer, but in many cases it will not sanitize or remove mold at its root. It will bleach out the color, of course, so that it goes clear, giving the appearance that the problem's been removed, but it cannot, in many cases, get down into the microflora and destroy the mold at its root. Oh, just get rid of the water. Everything will be fine. Well, that's not always enough to protect your property. Most of the affected materials do have the ability to retain moisture, and elevated moisture levels are the main cause of much of the residual damage from flooding. Well, lots of air fresheners, that'll help. Well, that's not true. In actuality, most air fresheners only attempt to mask the odors. The odors are an indication that moisture, contamination, or growth still exist. And the chemicals in those fresheners can also be a source of indoor air quality contamination. Well, your insurance company is going to take care of the problem. Don't worry about it. Well, of course, insurance companies are not always quick to respond because of the heavy workloads, the emergency claims that bog things down and delay payments. Many homeowner insurance policies have exclusions that limit or exempt the insurance company from paying a claim. An example would be a claim to an insurance company for water damage from, say, groundwater intrusion. In most cases, the claim could not be covered unless you had flood insurance and the area that you're in was declared a disaster area by some government agency. A similar situation may occur with mold damage, and the water damage in the home may be covered by the insurance company, but the mold damage as the result of the water would not be covered. Here are several resources that may provide you with some additional assistance. Of course, the FEMA and the EPA government websites are good resources for more information about how to contact those agencies in an emergency. And also at the normie.org website, we've located a lot of resources for you, articles in regards to antimicrobials, information about mold screening kits, and other things that we feel will be helpful to you. We highly recommend that you seek professional assistance when dealing with a flood, mold, or indoor air quality issue. And please remember that the information that we have been providing to you is really for your information and not intended to replace professional training and assistance. I want to personally thank you for taking the time to listen to this overview. I am hoping that you will benefit from the resources we've made available to you, but also from the training that we offer industry professionals to help you through the process of getting things back to normal. It's my hope that you will never be faced with the issues we've discussed, but if you are, you will now be better prepared. Thank you.
Welcome to Straight Talk. Today's topic impacts everyone. We're going to talk about cleaning for health. We all understand how critical effective cleaning is for reducing the spread of illness and ensuring safe, healthy environments. From offices to hospitals, workplaces to public spaces, and even your own home, cleaning for health should be the gold standard. However, despite its importance, fully implementing this approach often faces challenges, limited resources, a lack of training, and competing priorities, to name a few. So how do we bridge the gap between intention and action? How can we move beyond the basics and make fundamental, impactful changes for public health? To discuss this issue of cleaning for health, what can we do to make it reality and get beyond the challenges? I'm pleased to welcome Dr. Gavin McGregor-Skinner, Senior Director at ISSA. Gavin, how are you?
I'm doing great, thanks, Jeff.
So am I. How about that? We have a lot to talk about today, Gavin. It's an important topic. And I wanted to talk to you about this because I had a conversation with a lifetime veteran of the cleaning industry recently, and he's passionate about cleaning for health. He wants to see real change. He lamented, though, that through his entire long career, he hasn't seen real change, that where we're at right now with cleaning for health may not be any better than decades ago. He asked me the question, Jeff, have I wasted my time? That's a sobering question. When you think about that, Gavin, what would be your response? What would you say to that gentleman or anyone that has those types of concerns?
This is so important, just straight off the bat. Do you measure performance when you clean any surface in any building? And that means, do you have a quality management system? And this is so important for the whole value chain of the clean industry. What are the quality management systems that we want to see in place? You know, the set of processes, the procedures that help any building, any facility manager, anyone that cleans to meet customer needs and regulatory requirements. And do you have a way to measure the levels of cleanliness so you can show that there's a return on investment for the work that you're already spending money on, and you're using time and money and people to go and actually clean those surfaces that we do on a regular basis?
I think, Gavin, we all know that we experience unhealthy situations in our homes, public places, everywhere we go. It's reality. And part of our conversation today is about, as you mentioned, measuring performance indicators. And recently, a colleague of mine took some pictures and videos in a hotel room he was in. Now, this is a cleaning expert. He had a black light. And he shared those with me, and it's quite disturbing. In fact, I'm going to put those up now as we have this conversation and look at those. But as you look at this, Gavin, this video, the contaminants on the chair and the ottoman, what do you think? Why is this happening? What can we do about this? And it's everywhere. What do you think?
Well, let's look at this photo again just with our eye, and then using a tool like the ultraviolet light, the UV light, Jeff, is actually a tool that we use across the profession for measuring performance, but also identifying areas that may need to be cleaned so that we can actually be more strategic and save resources, save money, save time by finding areas that we should be focusing on. Instead of saying I have to clean the whole carpet, I find the areas that through with my UV black light that are dirty or stains, and I get to remove those. So this is again going back to this quality management system. Let's look at this chair in this building. It was a hotel. Is it clean? Is it acceptable? Does it meet the standard? And my answer when I look at it is no. It doesn't meet the standard of care. The standard of care in the cleaning industry are those critical methods and procedures for cleaning. And it shows to me that this particular building has accepted that stains, probably on the couch, on the chair, maybe even on the carpet and the mattress, haven't seen photos of that, are acceptable. I don't think that's correct, because when I look at this chair, Jeff, and I now see that it's not clean, can it be cleaned? And I would say, yes, it can.
Okay. Some might say no. In fact, the person I had this conversation with said they need to just replace it. Reality is, will they actually clean it? And his conversation with management at the hotel was no, they didn't really seem to care that much. How sad is that? But let's talk about the technology, because if you know it's dirty, if you can see it, if you can measure it, test it, something needs to be done to fix that. Talk about black lights. What can they really do? How should we use them? Can you get into that?
Well, yes, Jeff, and I'm going to put a question out to everyone across the whole value chain of the industry that focuses on cleaning indoor buildings and making them healthy and safe. And the point here is, Jeff, there are tools. We have a tool, and here's one here, right? This is a ultraviolet black light. The wavelength is 365 nanometers. Again, I would recommend anyone can use this.
Hold it up, Gavin. Hold it up a bit more. So it's a flashlight.
It is. It's a flashlight, and the special lens in there, the lights in there, Jeff, gives us 365 nanometers of wavelength.
Okay.
Now that's a special number because again, this is UVA light. It's above 315 nanometers. This is 365, so it's not harmful to the eyes and the skin. But I would highly recommend you follow the manufacturer's safety instructions for any of these lights, and you do not, be responsible. Don't shine them at people's eyes or on your skin. But this is not the UVB, UVC light, which is below 315 nanometers, which has health effects and dangerous to eyes and skin. So this is a very safe cleaning confirmation tool. This could be a citizen science project, Jeff. This could be a citizen science project where over 300 million Americans could get one of these and send us into their stories of what they think is clean and what's not clean. And then we're going to go out to our industry subject matter experts and say, why do we use these tools? Because we measure cleanliness, we measure performance. And that becomes a quality management system. Now, the challenge we have in the hotel and other buildings where we go to is they just don't know how to do it. We saw with the magic of the UV light at 365 nanometers, it made the invisible visible. We have stains. Let's just call them stains. We don't actually know what was on that fabric, that cloth, that couch, that chair, but we do know there's stains and they should be removed. The challenge we have, Jeff, is they don't know how to do it. So the cleaning industry needs to pony up and go, we need training, we need education, we need quality management systems that use tools like a UV light, and we help measure performance. And that becomes through education, training, and just processes. And I bet you, $1 million, billion, gazillion dollars, you go back to that facility and go, how do you clean that couch? I went, I don't know. Haven't been trained. Would you like to be trained? And that's what ISSA does. We form collaborations with our members to develop protocols, procedures, and training, frontline training, because our manufacturers want it, our distributors want it, our cleaning companies want it, and our facility managers want it. And they go, oh, now we get it, Gavin. We can do this.
I like it. Gavin, imagine if every person in the country had one of those black lights, 300 million, and you showed up at your hotel and you said, I'd like to check into my hotel. I have my black light with me. What would they do? They'd be nervous. Accountability, right?
Hopefully they'd be confident going, hey, I followed the protocols and procedures. I know how to clean that couch. I know how to clean that mattress. I know how to clean that carpet. We're good. And they would,
Exactly.
and they'd have a quality management system. They go, we already checked yesterday. We checked this morning. You've got nothing on top of us. But
Yeah.
wouldn't it be good? Every citizen in the country.
Okay, we're ready. All joking aside, accountability is an issue. Performance indicators, education is so critical. But looking at where we are now and what you have seen in the past, how can we come together and make this reality to make the future of cleaning a better place, to make cleaning for health where we could say we've made real progress? What do we need to do right now, Gavin?
It takes a team. It takes collaboration. ISSA is the perfect organization. Let's go back out to those that make and create cleaning products, those that make mattresses, chairs, and carpet, the manufacturers, and ask them the question, are your products that you developed, are they being used as you designed them to be used? Are they being cleaned and maintained for health and safety and for just use in the way you designed? If not, then help us teach the others. Let's go to those that sell cleaning products, the distributors, the resellers, the wholesalers, the supermarkets, anywhere. Why are hotels not buying products that can be used to clean soft surfaces like chairs, couches, mattresses, and carpet? Why? Just ask that question. And then go back to the actual buildings, the facilities. For example, here's a hotel. And ask those that are responsible for health, safety, levels of cleanliness. Why can't you clean this chair? And how can ISSA and all our members come together and help you? And if they say we need product demonstrations, we'll do product demonstrations. If they say we need training and education, wouldn't it be great? Gavin and Jeff walk into a hotel and there's the sign in the lobby. This hotel has been cleaned to cleaning standards for the standard of care to ensure your health and safety. You won't find any stains or other stuff in here with your UV black light.
That's quite a speech, Gavin, and I like it. It sounds like it can be done, but it starts at the top. So a facility manager at a hotel like the one we just discussed needs to embrace this and talk to staff and talk to those who have solutions, talk to ISSA, bring the training in. It's going to cost some money. It has to be added into the budgets. Do you see that as something we can overcome? I mean, it costs money to do more.
Yeah, really good question, Jeff. So many of the facilities that I visit throughout the country, people go, I don't want them to have a culture of fear. I don't want to think that they're in trouble. And I go into a hotel, I go into a supermarket, I go to an airport, I go to a factory, I go to a school, and I look for dirt. I look to see how clean it is. Oh, no, I'm here to give you a quality management system with continuous improvement and consistent key performance indicators and metrics. I want you to measure cleanliness under your Cleaning for Health program, and it's doable. And you make that relationship, that partnership, that collaboration, and over time, it's a few weeks, a month. It doesn't take a long time. They go, wow, we now notice a difference. Did I blow out your budget? No, I didn't. I might have saved you some money, actually. Maybe you were over cleaning. Maybe you're doing too much. But maybe I'm making you more strategic in cleaning what matters to health and safety and to the material that you have in your building. And also, everyone's going, hey, we're doing a better job. This is a safer indoor space. Our cleaning workers want to be trained, Jeff. That's the biggest message I'm hearing right now. And then they want to put the patch on their on their sleeve, on their uniform, and say, I have been trained. I'm not unskilled. I am skilled because I clean based on science and evidence. I based on the chemistry of my products, the tools and the equipment. I know how to use it. I was in a hotel just recently, Jeff, and I said to the lady and the man who were cleaning the hallway in the room, what training did you get? And they went, we're parents. We know how to clean because we have kids. And I went, hang on, I'm about to sleep 8 hours in that room. It's clean to a standard, right? No, it's clean to how I clean my house and that's wrong. Let's make the cleaning industry professional. And that starts with education and training.
Gavin, well said. Appreciate your time today. Let's see what people do with this information. If you're a facility manager, if you're in charge of any type of cleaning in your facilities, your companies, any organization, accept the challenge. Let's make real change.
Hello, this is Governor J.B. Pritzker here to recognize March 23rd through 29th as International Cleaning Week. This week and every week, we're saluting the hardworking cleaning professionals who keep our state sparkling. The cleaning industry is essential, safeguarding our health and helping fuel our economy. According to the International Sanitary Supply Association, proper cleaning and disinfection slash virus concentrations by 42%, and with proper hand hygiene, that soars to 85%. I want to thank the ISSA, which has been headquartered in Illinois for over 100 years and has promoted the employment of thousands of Illinoisans across 300 member companies in our state. And to the workers on the front lines every day, I recognize this work is often thankless, but your selfless dedication does not go unnoticed, and the state of Illinois appreciates you. Happy International Cleaning Week.
On today's program, this GBAC TV Industry Alert, I am pleased to welcome Dr. Gavin McGregor-Skinner, the Senior Director of GBAC, the Division of ISSA. Gavin, you look healthy. How are you today?
Oh, Jeff, couldn't be better. It's spring and we're doing great.
Yes. Now, Gavin, I wonder if you're so healthy because you know how to use cleaning products appropriately.
Well, Jeff, what if I told you that I knew that 90% of the cleaning workers that we trained through our Cleaning for Health workshops last year could not recall one cleaning ingredient that was in the cleaning product they used?
I would say that's not too surprising, but here's the thing, Gavin. I think our cleaning professionals, they do their work, they know what they're doing. They might not think about those products, they trust the manufacturer, or they know the products work and they want simple. Tell us, I know you have an article coming up in a publication ISSA produces about this topic. Why is this important?
Because I think, Jeff, in the industry, the cleaning industry, when we learn something, when we have real data, real information, we just can't ignore it. We've got to act on it. And, Dyke Hoffman, Dave Mora, Jim Manus, and myself, we ran 54 in-person Cleaning for Health workshops in 2023. We trained 893 essential cleaning professionals, and 90% or 804 workers could tell us the cleaning product they use. That's where that's really important. But they could not tell us, Jeff, the ingredients, the chemicals in those products. And that's a real big health and safety issue, but also an efficacy issue. What products and due to their ingredients work on what surfaces.
I agree with that. I'm looking at your article now that people will be soon reading. You talk about surfactants, solvents, builders, enzymes, biological additives. Sounds like a science class to me. So tell us what the cleaner should know about the products they're using and where to get that information.
That's a great question, Jeff, because, the use of cleaning products, not just by the industry, the cleaning professionals, but by everyone, it's ubiquitous. It's everywhere. Cleaning products work because they contain certain chemical ingredients. And the challenge we have is that we need to formalize our training, our programs, our education programs to at least ensure, and this is where we really want cleaning professionals to really understand why that we're calling them professionals, is because they know how the products work, they know what the ingredients do, and it's not just by looking at the label, the safety data sheet, it's by understanding that you're right, it's a little bit of chemistry, Jeff, but understanding how a solvent works, a surfactant, a builder, an enzyme, a chelate, or a preservative, why are they in the products that we use, why they're important, and how to use them safely and, again, clean for health.
So thinking about that, what actions do you want our viewers to take moving forward? What should they do? Wrap it up for us.
Well, really important, Jeff. We went through in our Clean for Health workshops, the 54 that we ran. We talked to people about the labels. We talked about the safety data sheets. We said, if I said to you, Jeff, this chemical is considered hazardous, what do? This product causes burns to eyes, skin, and mucous membranes. This product has to be used and you need to ensure adequate ventilation. Or you need to use personal protective equipment, and it always says as required. Or maybe, for example, it's very toxic to aquatic life with long-lasting effects. All that needs to be understood. What are the actions we take when we know a little bit more knowledge than what we've got now on the cleaning ingredients we have in cleaning products? And then more importantly, Jeff, that critical next step, how to make informed choices. And that's where the ISSA has partnered with Penn State College of Medicine, with Dr. Rebecca Bascom, with the City of New York School of Medicine, Dr. Omrana Pashat Razak, on a 2-year project on making safer choices, where we're going to develop a practical toolkit to ensure that we can increase the knowledge, the demand, and use of cleaning products, and so that people understand how the ingredients work, how to use them safely, how to use them effectively, but also how to talk about the ingredients we use in cleaning products as professionals.
I want to welcome 2 special guests today to our interview, and I'm calling this an interview a little bit more than just a discussion, because there's some points that we really want to get out here. So I have Dr. Gavin McGregor Skinner, the Senior Director from ISSA and GBAC, the Global Bio Advisory Council, if I got that correctly.
Yeah, that's pretty good, Lance.
And Douglas Hoffman, the Executive Director of NORMI. So welcome.
Hey, Lance. Hey, welcome.
Okay, let's get started. I mean, we're here to talk about the devastation that's going on right now out in California, especially in LA County. And it's an environmental disaster, it's a health disaster, it's a humanitarian disaster. And it's of such a large scale and such a densely populated area that the numbers are staggering. I mean, just to get us started, they're talking about so far, with just the 5 fires, over 10,000 structures being destroyed and almost 200,000 people being evacuated or told to evacuate their current locations. And as we were talking about earlier, some are being evacuated from their evacuation locations because the fires are jumping so quickly. So with that, Gavin, let me bring you in first just to get your reaction on what you see from what you've been following.
Yeah, Lance. So again, from both perspective of ISSA that represents their members, NORMI that represents their members, we wanted to reach out today. So look, this event started, Lance, Tuesday, January 7th. So we're trying to move as quickly as we can as member organizations that represent thousands of members across the country, that we're here to help, we're here to listen, but more importantly, we're here to network and help facilitate any of those of our member organizations that are going to deploy to California, because we're still in an emergency situation, but we're rapidly going to move into recovery. And so what we're seeing right now, that this is not just an environmental disaster, it's still ongoing. It hasn't ended, Lance, but it's going to be a significant public health emergency with immediate and long-term consequences.
Well, it's already reached that level because people are functioning and trying to function and exist within these smoked areas, and they are breathing this in. So we've already reached that. I think it's just going to continue to grow larger and larger. And Doug, I know that we've talked earlier about the NORMI membership, especially our presence out on the West Coast into California, and we're really concerned about our membership out there, as well as with ISSA, and what we're able to do to try to help going forward.
Yeah, I think it's interesting because our industry, which is really a microbial industry, not just mold, really has an opportunity here to help a lot of people. One of the things that we've talked a little bit about among ourselves is after the fires last year in Canada, Canadian fires, I think there were a lot of people that didn't realize that there's a tremendous microbial problem that happens after a fire, not just during, but some of the bacteria and fungi actually survive the fire. I know a lot of people think, well, it just burns everything up, but that's just not the case. And so if you're dealing, as Dr. Gavin said, with a public health concern, public health emergency, not only for the people that are there living and breathing those contaminants, but also those who come in to help. They need to be careful and make sure that they're protecting themselves from the contaminants that are in that environment.
You see on the news people running around wearing bandanas and things over their face. And obviously from our industries, we know that's not appropriate. But Gavin, if you could like say something to some of the people that are out there, what would you advise them to do in these environments?
Yeah, really good point, Lance and Doug. Yes, members from both ISSA and NORMI will be deploying to help in California. It's an emergency; it needs to be done. But we've really got to look at the hazards we're going to face, Lance, which are both in the air and on the surfaces. Look at the fact that the most immediate hazard right now is that complex mix of pollutants of fire, smoke, and soot. Now, that particulate matter measures anywhere from 2.5 micrometers or smaller, which allows it to get into the lungs and then into your bloodstream. And so the short-term exposure to smoke, you get mild irritations, you get runny noses, scratchy throats, but then you get severe conditions such as bronchitis. And then for some sensitive groups, you'll get pre-existing respiratory and cardiovascular issues. You get even higher risks of inflammation and problems from the pollutants that are in smoke. And so it's so important that any ISSA member, any NORMI member that is going to deploy, please reach out to us if you need help in doing your hazard assessments, and reach out to us if you need help in identifying the correct and appropriate personal protective equipment, and even the processes of how to operate in such a hazardous environment that has seen a fire go through an urban environment.
Well, that's one of the things that we talk about with the Environmental Task Force, and trying to get our memberships up to the level where they understand how to operate under FEMA rules and, engagements. And that's all part of safety for them. You want to be part of the solution, not part of the problem as a victim.
Well, I think one of the things that I think is interesting that I think we should probably recommend is we talk about personal protection equipment, and almost always when people go into a cleanup situation, they're going to wear gloves. They're concerned about the things that they're touching, but I don't think they think as much about the things that they're actually breathing. And even when the smoke is gone, some of that submicron material and particles that Dr. Gavin's talking about, like a little magic carpet ride, is carrying that bacteria around. Bacteria doesn't fly on its own, but it actually can be on those particles, and then you're inhaling it, which is a huge, huge issue. So face protection is important. Eye protection is important to make sure that you're protecting yourself from the potential contaminants that are there. As we always say, that you can't see, it might be that the smoke is gone, but you can be sure that at submicron level, particles are still elevated. And when the particles are elevated, so are the bacteria and fungi problems.
You mentioned something, Doug, quickly there about eye protection. And that was one of the things that we saw with the fires from Canada a year and a half ago, when the smoke conditions were so bad on the East Coast in the United States. People were still out, they were wearing masks, but nobody was really paying attention to eye protection. And I spoke with several optometrists and ophthalmologists several weeks later, and they had a massive increase in eye infections, irritation, scratched corneas, all from the exposure and people not being protected.
Yeah. Well, I think the other thing too is making sure that if I'm working in that area, if I'm trying to help folks clean up, I need to have a place where I can rest at night, a place where I can go and a safe place, as it were, where my body can rebuild. I'm not a doctor, but I think this is right, that the whole purpose of rest is to give our bodies a chance to rebuild itself. To be strong and be able to go back into that environment and be able to withstand the contaminants that are there. So having a place where they can go, where they're safe and protected, I think is really important as well.
I think the term they use for that is resiliency. And it's really the ability of your body to regenerate so you can continue to work in those environments. As far as what we're trying to do here, we want to hear from our members also. We can be contacted directly at our email address at support@normie.org. If there's anything you want to reach out to us, you have questions for us. If you have video you want to share with us, anything like that, please send it our way. And if there's anything we can do to help, we will do that. I have been reaching out to some of our members out on the West Coast, and we're trying to set up some interviews from people that are out there working and doing some firsthand observations of what's going on, not just at the fire scenes, because that's truly what the news media is covering right now. But we're talking inland, away from some of the direct fires, that these are areas being affected by the smoke and all the contaminants that are affecting homes where people are still living. And how do you deal with that? So, Gavin, I don't know if you have any suggestions on that. I know we talked about safe rooms in the past.
It requires preparation. It requires planning, Lance. And I really want to emphasize there is going to be a lot of work for ISSA members and NORMI members to do in California. But please do not underestimate the hazards and the risk you're going to face in this environment. Do your hazards assessments, do your risk assessments, ensure that what you have is going to keep you and your workers safe, because there's both those immediate health effects and long-term health effects when you work in a very toxic, very highly contaminated environment. And I'm just going to emphasize how important this is, Lance. There was a study done in California that was published in 2024. It involved over more than 1 million people, this study, and it showed a strong correlation between the PM 2.5, the particulate matter 2.5 exposure of smoke and fire debris and soot, and future diagnosis of dementia. And we don't often think about, yes, the physical health, but also the mental health conditions that these environments can impact on. Pregnant women, they'll face huge potential impacts on fetal development. There's a high likelihood of premature and low birth weight babies, very extensively studied in areas that have suffered fire and smoke damage. We know that there's a number of studies out there on cardiovascular issues. We know that just a study that found that exposure to smoke during a severe fire event led to a 70% increase in out-of-hospital cardiac arrests. So important. If you are a supervisor, if you're a manager, if you're going to be one of those workers there, identify the hazards, know your risks, and just work in a situation with the appropriate personal protective equipment and the process. Take those rests and breaks when you need it. This recovery will take a long time. It will not a race. We've all seen the terrible, terrible images on the news in the last 3 days of areas, vast houses and buildings being completely destroyed. They're the ones that we know of. What about all the ones that have been damaged? Lance, we don't have a number for that just yet.
Yeah, and that was the point about the fringe areas, as I called it, the areas not directly on fire or have been destroyed already, where people are still living. It's the concern that they're not protecting themselves, whether they're working or living in their areas. And that's what they really need to start ramping up on now. We talked about masks. I mean, an N95 would really be the absolute minimum, to even be close. And truthfully, that doesn't provide you any oxygen. If you're in a low oxygen environment, a fire area, heavy smoke, that's not going to help you. So you really need to know where you're at and to know what is required to be there to be safe. Okay.
So I have a question.
Yeah.
I have a question, and we may want to edit this out. I don't know, Lance, but and I don't want to put Dr. Gavin on the spot, but I remember reading a study several years ago, if I'm correct, and maybe I'm not, that's why I'm asking you, where they were talking about submicron particles. I think the study was done in Germany, but they were submicron particles are so tiny that they go through your natural defenses and can actually show up in the blood and possibly cause blood clotting.
I'm not familiar with that particular study, but yes, there are reports of that that I'm aware of, Doug. Again, I think the most important message from both you, me, and Lance right now is don't neglect the potential immediate consequences and long-term consequences of repeated and prolonged smoke exposure, soot exposure, debris, contaminants, toxic contaminants in an environment that has had fire go through it and smoke go through it. And so that's, yeah, we could sit here academically and talk about all the possibilities, but right now, as Lance said, you have to have the right respirator that fits. You have to be fit tested. You have the right eye protection. You've got to ensure that areas of your body that it's exposed is going to be in contact with toxic contaminants and pollutants. What do you do at night when you go for a rest, a break? How do you wash that off and do it safely? What do you do with your clothes that you wore today, and what are you going to wear tomorrow when you go back out into the same toxic environment that's suffered from all this fire and smoke damage? These are key questions. I think the way that we're approaching this is the same way that we approach those communities last year that got hit by hurricanes. These are significant disasters. These are really sad disasters. But we do know that members of ISSA and members of NORMI will respond. And the key message here is we are here to help.
Yeah, everybody has to keep in mind that dealing with fire is something different than most people are used to. It's almost a living, breathing thing. It has a mind of its own. And there's a lot of counterintuitive information out there or ideas that you have to keep in mind. People love the smell of campfires. So when you have a forest that's burning, oh, this smells great. That's fine, except you also have homes, businesses, industrial plants burning, and all of that pollutant is in the air that you're breathing in, along with the smell of the pleasant pine tree that's burning. So taking that in is toxic. The other thing about fires are that are counterintuitive. If you look at a firefighter wearing turnout gear, that gear is designed to protect them from the severe heat, 400 or 500 degrees that they're exposed to on the outside. Most people, when they see a fireman, if they look in distress, want to hose them down and cool them off. That's probably the worst thing you could ever do. When you put water on that 500-degree jacket, you've created steam, which could actually kill somebody. So it's counterintuitive when you deal with fire. So don't get lulled into a false sense of security thinking, oh, it's like a campfire in my backyard. This is a completely different beast.
Well, and I think one of the best examples that I could give that all of us lived through, have continued to live through in terms of long-term health effects as the results of a disaster like we're dealing with right now in California, is what happened with 9/11. I mean, there are people still dealing with the health effects of not wearing the proper personal protection equipment during that disaster. So we're not making it up. I mean, that's just the way it is.
And I think that's important, Doug. We want to ensure that we help as much as we can our ISSA members and our NORMI members to be professional, but also we want to help with telling their stories, why they do deploy. I think a lot of what the work we do in our industry, in our community, doesn't get told. And again, the purpose of us responding today with this video was to say, we're here to listen to you, but also to tell other people the wonderful things you're going to be doing in the next days, weeks, and months as this recovery effort will start to scale up.
Well, I'd like to invite anybody watching this, an ISSA member, a NORMI member, or anybody else that works in this amazing industry that we deal with, indoor air quality, mold assessment, mold remediation, microbial issues, fire restoration, to reach out to us. Again, support@normi.org is an email address you can reach us at. You can go to our websites at issa.com, at normi.org. We're out there, and you can find us where you can reach out to us, contact us, let us know your stories, as Dr. Gavin had just said. We want the information coming to us from the people that are on the ground firsthand, but we want you to be safe too. Any last words from you gentlemen?
It's going to be busy, Lance. There's a lot of work to be done. And again, it's going to take individual companies, individual organizations will go and respond, but it's going to be an industry-wide team effort to get a lot of those people that have suffered, not just the places where the buildings have been completely destroyed, but all the buildings that we still don't have a good number or account of that have been damaged. And that's going to take a massive team effort. So this is the start of lots and lots of work to be done.
Absolutely. I mean, we are not in a race to put out the fires. That's not what our job is. There's firefighters out there racing to do that. This is becoming a marathon, and this is going to be a long-term event. And we're all going to have to pitch in and help. And we're putting it out there. We're here to help. And anything anybody out there watching this wants to do to join in, provide us information, videos, interviews, please reach out. Doug, anything else?
No, I'll just say thank you to you and Dr. Gavin for bringing this forward. I think it's really important that we tell people that there are answers. And as Dr. Gavin said, being prepared is the start. If you haven't gotten prepared for this and you're dealing with a disaster, let us know. We want to help.
Thank you both.
Thanks, Lance.
We hear about it in the news. It's an issue that we all want to be aware of. We need to be aware of it, especially in the cleaning industry. What are we talking about? Meth contamination in facilities. We know what happens. Today's episode is going to spotlight what we need to know right now in the cleaning industry. With me today is Dr. Gavin McGregor Skinner, the Senior Director of GBAC, and also Scott Vogel, the Chief Operations Officer with EmergiClean in New Jersey. And I'll say this before I let them talk. They have a lot of initials after their names. I don't have any, so I'll just ask the questions. So, Gavin, Scott, welcome.
Thanks, Jeff.
Thank you, Jeff. Thanks for having me.
Well, let's get right into this because we want to help the industry. Gavin, let's start with you. Why is meth contamination cleanup in facilities, that topic, so important for us?
It's back in the media, Jeff. Drug use in public spaces is everywhere. It happens. We know that. But more importantly, exposure to drug residues is a known risk for every cleaning professional. And I just wanted to highlight, Jeff, what's happened in the news this week. And again, I'm going to start off by saying this is not a problem in public libraries. It's a problem everywhere, in every space that we in the built environment. So in the news this week, the Englewood Public Library in Colorado was temporarily closed due to meth contamination after tests showed exhaust vents were contaminated with meth. Now, this is important, above the Colorado state threshold levels. So you might think, why was this library tested? Well, because another library in Boulder a few weeks ago, about 35 miles from Englewood, was recently closed due to meth contamination. Now, the tests that were done on January the 6th at Englewood Library were done as a proactive measure. The results showed the restrooms exceeded state thresholds for methamphetamine contamination, but there are other spaces in the library that reflected lower levels of contamination, but they were still contaminated with meth. And I just wanted to highlight for everyone, Jeff, but in 2021 and now 2022, in 2021 specifically, more people died in the US from drug-induced deaths. Most were overdoses from meth and fentanyl. And if you look closely at this data, yes, you see meth increased and there were more deaths in those cases where it's always been used, but it also appeared in other parts of the country where it was previously unheard of. So again, I want to emphasize, Jeff, it's not a problem just for libraries. It's a drug use is in public spaces everywhere. And this is a known hazard for every cleaning professional in the cleaning industry.
When someone goes to a library, you would think it's safe. Who would have thought that they would find this there? Other facilities as well. Scott, let's go to you. Those watching this might wonder, well, I can clean it up. I can go in and I'm a cleaning company. Do you need to be certified to clean this type of issue, meth contamination or other issues like this?
Well, the answer is kind of complicated. It's a yes and no. In the United States, there's currently no federal regulations regarding the cleanup. There's only instructions like support that the government has given us. So in 2007, the Meth Remediation Act was passed by Congress, and that empowered the EPA to put volunteer guidelines in place. Since that, a lot of states have adapted standards or some type of certification, but there's a lot of states lacking. And like what Gavin was mentioning before, it's become such a widespread event that the states that haven't created standards or certifications are really left behind. And in that document from the EPA that was released in 2013, what it says is if you don't have that state guideline or certification, then you have to resort back to the occupational health and safety for the 40-hour HAZWOPER, which is a hazardous waste and emergency preparedness and response. So we have to look at that as a whole. The certification is a lot more complicated because you have how you clean it up, and you also have the safety and health of your employees. So they come together, and really we've as an industry and well as the federal government, we have lacked on that standard completely.
Okay. I want to touch on processes here in a minute, but first, Gavin, set us up. Is this meth contamination issue a health risk for the cleaning industry?
I would state, in my personal belief, my expertise, Jeff, yes, it is. And I want to just highlight, again, it's a very highly addictive stimulant. If for those who don't know and don't want to know, but meth can be ingested by smoking, snorting. You could swallow a pill or injection. But more importantly, for the cleaning industry, smoking meth releases several contaminants into the surrounding environment. Again, the most concerning one that we have for cleaning professionals is the meth vapor itself. Now, the National Institute on Drug Abuse states that when people are exposed to secondhand smoke, can test positive for meth afterward. But there's no specific number, Jeff, that identifies what is that unhealthy level of secondary meth exposure. We're talking about third-hand exposure. And that third-hand exposure comes from that meth vapor, that meth smoke that settles in, that's in the air, but also settles on surfaces. And so it's not a debate today about whether workers will have serious risk of health problems. It's the debate that what we're talking about right now is that smoking meth can contaminate the surfaces and air, and we know that it can persist for months to years. Now, we do know that research on the health impacts from touching a surface that has meth residue on it is lacking. We know that. But when that research is lacking, Jeff, we go to worker health reports. So people that have got sick at work have gone to the doctor or the hospital, and we know from review of those worker health reports that we've seen skin and eye irritations. We know there's been cough or asthma-like symptoms. We know that those people get increased respiratory infections, sleep issues, changes in mood, they get headaches, and then they also have memory difficulties. So even though the research is lacking about whether the third hand actually happens, we believe it does, based on the health reports, the clear reports. But more importantly, the National Institute on Drug Abuse also says that the health risks are more significant after prolonged or a long time exposure to meth contamination. So regardless, Jeff, of how unclear the science and policy is right now, that risk of meth exposure, that drug contamination in areas where cleaning professionals work every day is a known hazard. And really, we firmly believe that no one should be going to work without receiving education and training on a known hazard.
Okay, good information. Scott, in your previous comment, you talked about training and maybe some certification. So can we assume there are standards, procedures for cleaning spaces that are contaminated with drugs?
Well, as I mentioned before, the EPA has come out with that EPA volunteer guidelines for meth and fentanyl laboratory cleanups as well. And that was actually revised in 2021 because of the increase of fentanyl. Now, you do have some standards that are coming out. The IRCRC is coming out with the S900. So there is some sort of industry-related standards that are coming out. Most of your standards are related back into the cleanup and the results and the levels which are allowed, which are based on the state guidelines, which every state is completely different. And we have to look at that. There's no universal number. It is, one could be 0.1 micrograms compared to 1.5. So it really differs. And that's why there's been no universal standard that came up, because everybody is indecisive on what that true number is and how to go about it.
Okay. Why don't you take a moment and just walk us through the process for cleaning meth contamination and validating cleanliness? I know you can't get into all the details, but big picture, before people jump into this, what should they know?
Well, like you said, I could be here for 48 hours just talking about how to clean it up. When we look at the processing validation, I always recommend right off the bat a third-party laboratory for validation. Any type of testing and cleaning should be done on a third party. Just help your liability and anything, just to make sure, especially when we're dealing with meth or fentanyl and any illicit drug cleanup that we're dealing with. Now, when we go a little bit, people have to understand, when you look at the test results, take a sweet and low package, 1 gram of that. By the amounts of trace that some states require, spread that over 25 acres. And if one of that hits, then technically it's a positive. And we don't look at it that way. We think about it as just a small little area, but the results in some states require so detailed cleaning. If the process starts with HEPA vacuuming, ventilation, risk assessment, all of these are from start to finish. And each job will kind of decide a different way on how to attack it, as I would look at it. Are you dealing with the library? Are you dealing with a drug laboratory? Are you dealing with a school, a healthcare setting? Every type of situation will kind of lead you down its own path on the processes. And that's why I could be here for 48 hours. It's just a mere fact of starting off, it's essential that we really do that risk assessment. And then following, for example, the EPA guidelines. It's a really good package. They talk about HEPA clean, vacuuming, wipe down. They talk about all of that. And there are some third-party schools out there as well, like I said, the EPA volunteer guidelines that will give you guidance. But when it comes to the processing, really start and understand the beginning needs a risk assessment, and you need to know what you're going into. And then on back end, when it comes to validation, because what I talked about and how such a small level could make you fail, you have to have that validation from third party. And separating the cleaning from validation is essential when we deal with illicit drug cleanup from meth or any type of fentanyl, any other type of opioids.
Okay, well, I think I'm going to cancel my plans to get into the industry and do that kind of work. I'll leave that to you experts, Scott. Thank you for the details. Gavin, let's have you wrap up this episode and just talk about the big issues for the cleaning industry and what we need to know moving forward.
Yeah, totally agree with what Scott just said, Jeff. Again, let's focus back. Cleaning is about removing contaminants. Cleaning is based on science. Again, you and I have talked about this a lot, Jeff. What you can't see can hurt you. So it's not a matter of waiting for the document to be written or the policies there. It's the fact that this is a known risk right now. And when it's a known risk, again, I totally agree with what Scott said. We need standards for testing, we need standards for cleaning, and we need standards for validating. We need to ensure that everything that needs to be done, the processes, procedures, the equipment, the products in cleaning for health and safety when it comes to drug contamination is known. It's widely taught. It's widely educated. It should not be a secret, Jeff. So much of what we do in the cleaning industry remains hidden. We're going to be more transparent. Everyone in the industry right now should be trained, educated on how to clean up for drug contamination. And I thoroughly believe that because from the data that we've seen across the country, that risk is just about everywhere.
Good afternoon, everyone. I'd like to welcome you here to our webinar we have going this afternoon. And I want to welcome our guest speakers, Doug Hoffman, the Executive Director of NORMI, and Gavin McGregor Skinner, who is the Senior Director from ISSA, I believe. I got your titles correct. If I didn't, I apologize. But I think I got it correctly.
They're just titles, Lance. They're not that important.
I know. Well, I want to thank everybody for joining us today. In recent events of the hurricane or hurricanes that have gone by, we've started to notice a lot of things happening within our industry and a lot of the verticals around us. And a lot of it's concerning, and we wanted to bring it to everybody's attention and offer some options. That's the easiest way for me to explain this. We're going to try to talk about staying healthy as workers through these events that have just happened with the two hurricanes. A lot of the risks that are involved with exposure to mold, and there's a lot of myths out there that people hear and they try to run with without following the science. And I know these are terms that we use a lot in our industry, following the science especially, but people don't really do that. So I want to turn this over to Doug and let you just start off with an introduction as to what your feelings are with the response to Helene and Milton, the two hurricanes that just passed, and a lot of people are still reeling from both of them.
Yeah. Well, I think some things have changed a lot since we first experienced Hurricane Katrina in 2005. I think there's a lot that's been changed for the better, but unfortunately, some things seem to remain the same. And I remember when we did Katrina in 2005, one of the things that we were invited to do, which was really helpful to us and I think to the public, was to be able to hold seminars in the libraries and actually talk with folks about the things that they should be doing to not only know for sure that the work was being done correctly, but maybe more importantly was to how to protect themselves and make sure that they were protected from the health effects. And one of the things that prompted us to do that, Lance, in 2005, and why that was so important to talk about was, as you recall, just a few years earlier in 2001, when the towers fell, people were really concerned, and they began to realize that those health effects from that kind of disaster could go on for years. And as far as I know, it's still going on. And so it was pretty easy for us to talk about that in 2005. The unfortunate thing is that it seems as though we were dealing with kind of the same situation here. I see pictures of people dealing with contaminated environments with no kind of personal protection equipment at all. Volunteers jumping in, which of course we're always grateful for, but volunteers jumping in and doing work and not protecting themselves, not considering the potential health effects that they're dealing with. And then on the other side of that, you've got the problem with guys that really aren't licensed or trained to do some of the work. And so that's, in some ways it's changed, in some ways it's not changed. I think the government has been a much better, much better in their response. I don't think it's ever what we would want it to be, but I can tell you that they're better than they did in 2005. So that's how I see it. I see some things have gotten better. Other things seem to remain the same.
Hey, Dr. Gavin, before we get into specifics, your take on what's been going on, just like Doug was saying.
Yeah, this is really important just to put everyone into the big picture of what's happening right now. So Normie, ISSA have an alliance. We're working together as Normie has promoted this initiative to create an environmental task force to actually respond to disasters and emergencies based on science and based on evidence. Now, for me this week, Tuesday night was not a good night. I had a whiskey tango foxtrot moment, and you should know what that means. And I went, I've got to ring Doug. And what happened through our Normie Environmental Task Force, Lance, people on the ground in North Carolina, Tennessee, and Georgia, working really hard during the day, get a bit of downtime when it's dark at night to make phone calls, contact me and said, they're handing out bleach, sodium hypochlorite. And I said, to whom? Everyone. To do what? To prevent or clean the mold that's already there. We're actually seeing buildings right now in North Carolina, Tennessee, and Georgia with mold growth, visible mold growth. And I said, oh, okay, it's okay. Probably a few hundred, containers of, we're not going to fight that battle. No, it's thousands of containers they're seeing in those different states. And that's a big problem. And straight away, I called Doug and I said, look, we've got to be responsible here. This is where we're going now. We've just had Hurricane Helene. We've had Hurricane Milton. Let's make sure that this time we do what's based on science, based on evidence, and we do it with the right advice. And I think it's really important in this session we have today to talk with Doug, yourself, but also look at what's out there right now, what is wrong, and I'm going to use that word pretty strongly. It is wrong, and what is correct based on science and evidence.
There's two different components to what you're talking about here. One is the effectiveness of bleach in this case on a mold environment. And the other one is the precautions and health risks to the people using it. So Doug, I don't know if you'd like to start with, I know you have a lot of research and data behind the effectiveness side, if you want to start there.
Yes, I'd be happy to. It's interesting because we were talking yesterday about this. The article that I wrote actually in 1998 was about how bleach should not be used to deal with mold. And so again, as I said, some things have changed, some things are better. I know Clorox, for instance, has a good portfolio of products that do include sodium hypochlorite and have been approved by the EPA to do work. So we're not talking about a specific company. What we're talking about is jug bleach, bleach that you would buy over the counter that has nothing in it except sodium hypochlorite. And I'm reckoning back again, Lance, to 2005 for Katrina. And I can remember one of the frustrating things was I'm at the library talking about don't use bleach, and it's being handed out by the gallon, and because it's inexpensive. But the problem that I knew then, and that we've continued to teach on, and I think the science is coming around, obviously, for people to realize that this is the case, is that unfortunately jug bleach will get rid of the staining, but it does not get down into the bioslime, as we call it, and actually destroy the mold that's there. And so oftentimes it'll come back. And of course, then you also have the health effects. We talked about a minute ago, PPE. What are they using? Are they using the right kind of mask, the right kind of gloves? If they're using bleach, are they mixing it with anything that's going to create a toxic environment? So that's our big concern, is how do they protect themselves? And then how do they utilize the right kind of chemistries that are not going to present problems for them, not only now, but later?
You know, Gavin, following up on what Doug said, looking at it from more on the medical side of protecting yourself, I want you to address that. But there's one other thing that you had mentioned in a previous interview where you were working overseas dealing with Ebola. And I remember you mentioning pits being dug around the tents and filled with bleach. The bleach had a specific purpose there for the bacteria, but where do you stand on it with the mold issue?
Yeah, good question, Lance. I'm going to just emphasize bleach, sodium hypochlorite, made from reacting chlorine with sodium hydroxide, is an excellent disinfectant and an antimicrobial agent. I'm going to make it really clear. In 1998, Doug Hoffman wrote, bleach doesn't kill mold. In 2024, I'm going to say again, bleach doesn't kill mold, but we're seeing it handed out. Now, in 2014, I had 3 trips to West Africa. We had the Ebola outbreaks. I was setting up Ebola hospitals and managing teams to run those hospitals. And our metric there was, Gavin, you're not safe. You don't smell strong enough. And what they were spraying me with was bleach. And you know, probably some people have heard the story. I lost my sense of taste and smell for months after my 3rd trip. You know, each deployment's about 21 days. After my 3rd deployment, I came back and went, I'm done. I can't do anymore. I've lost my taste. I've lost my sense of smell. My wife was great. Was very happy to see me to come back and said, I'm going to take you for the biggest steak you've ever seen in your life, because I hadn't eaten very much and lost a lot of weight on deployment like we always do. But the bleach had destroyed my sense of taste and smell. Now, so it's a good disinfectant. It's a good antimicrobial agent, but it doesn't kill mold. And I just wanted to highlight here, Lance, that this has been going on for a long time. Right now, let's get it really clear. The US Environmental Protection Agency, we call that the EPA, has a website. Should I use bleach to clean up mold? And what do they say on that website? Bleach is not recommended. So I'm going to put that in the chat so people can actually see that website. US Department of Labor, Occupational Safety and Health Administration, we call that OSHA, on their website, they have a brief guide to mold in the workplace. Doug published his article in 1998. They published this website in 2013. They haven't changed it because it's correct. It says, the use of a biocide, such as chlorine bleach, is not recommended. And I'm going to put that website in the chat. This is from the EPA and from OSHA.
While you're typing that, I'm just going to give everybody a hint on finding these sites if they can't use the link. The first one would be just do a search on EPA and mold to clean, or I'm sorry, and bleach to clean mold, and it'll come up with these sites, and you'll see exactly what it's talking about. And the same thing with OSHA. It would be OSHA and bleach as a biocide or bleach killing mold. And you will see this information that Gavin is talking about.
And this is where it gets really, really critical and really important here, Lance. I used to work for the US Centers for Disease Control and Prevention. I was an Epidemic Intelligence Service Officer, an EISO. Loved that job, had a fantastic job. did fantastic things with Ebola and many other highly infectious diseases like avian influenza or bird flu, tuberculosis, malaria. Really had a great career. I really enjoyed working at CDC. But, and I'm going to be very critical, the CDC has a website. It's called Guidelines for Cleaning Safely After Disaster. So Guidelines for Cleaning Safely After Disaster is the CDC website. Now, American Red Cross, many other volunteer organizations, many other non-government organizations, even local government officials, state government officials, all reference that website, the CDC website. And on that CDC website, it says, clean up mold with a mix of bleach and water. And that website was just updated February 9th, 2024, and it still has it there. Clean up mold with a mix of bleach and water as a guideline for cleaning safely after a disaster. I'm going to put that in the chat as well, Lance, and that's our problem. Doug wrote the article in 1998. OSHA, Department of Labor, Occupational Safety and Health Administration published a website that's still up to date in 2013. Bleach is not recommended. EPA says bleach is not recommended. The US Center for Disease Control and Prevention, CDC, says use bleach. Who's right, who's wrong? CDC is wrong.
One of the things that comes out of this is basic communications. When you say bleach, that means a lot of different things to a lot of different people. Bleach can be very watered down. It can be extremely, extremely strong. And I think the problem that we run into is people don't know the difference. Well, they said to use bleach. That's what I'm using. And it may not be effective. It's like when COVID came out and people were looking for alcohol that had to be over, I believe it was 90% isopropyl alcohol to have any real effect. People were just grabbing whatever they could find. So understanding the full meaning of what you're saying of using bleach, like the CDC was saying, is where you could create a toxic environment, dangerous to your health. I mean, you have to survive the cure, basically, in those situations with proper training, PPE, and everything else.
And unfortunately, Lance, I was a victim of overuse of bleach because our metric was when I came out of the Ebola hospital, which Ebola scares me. There's no doubt about it. It's a virus that I really get worried about when I'm treating patients or working in a hospital. But when I came out of the hospital, they went, Gavin, you don't smell strong enough. So they re-sprayed me with more bleach. We're in 2024 now, and we've got to go back to the science, go back to the evidence.
So the picture,
there's another side of this, Lance, that we haven't really talked a lot about, but I think it's interesting to note. We've been talking about folks' health and sodium hypochlorite, but there's another issue with jug bleach if you're talking about a long-time solution, because apparently from what we've seen and learned, that once you've cleaned a surface with bleach, it may set up a surface environment, a pH, that will not allow the protectants to bond to that surface. So if you're using a protectant that will keep the mold from coming back later, it may not even bond to the surface because of the pH the acidic environment, I think, that's left after the bleach has been put on that surface. So it's just another factor that I think we're learning more and more about.
Well, isn't it also an issue where bleach is really made up a large component of water, which as they start to separate over time and leach in different directions, one could be feeding the mold growth while the other one is inactive because it doesn't have the water to drive it? It's a chemistry.
I was just going to say, I don't know if I can speak to that specifically, but I do know that, yes, you're talking about a very small percentage of sodium hypochlorite compared to a huge percentage of water. And I don't think adding water to a potential mold issue is probably a good idea.
And you're right, Lance. A lot of the guidelines out there are misleading. They're not, the lack of specificity. I often hear that, oh yeah, we took bleach and we put 1 cup of bleach into a gallon of water. That 1 cup, 1 gallon, idea that you can clean everything, disinfect everything with 1 cup, 1 gallon. No, that's not how it is. And there actually requires, when you're doing dilution, more precision in the measurements. And so if I'm hearing from colleagues on the ground through the NORMI Environmental Task Force in North Carolina, Tennessee and Georgia that they're handing out sodium hypochlorite bleach. We don't know. We don't have a lot of details on the products or how that's being handed out, but we know a lot that's been handed out. There are no use guidelines. So where are the use guidelines? And then, as you correctly said, Lance, before, where are the safety guidelines? And that's really critical. And then when you go to safety, they start talking about, and even on the CDC guidelines for cleaning safely after disaster, right at that very top of that page is get the right safety gear. They talk about eye protection. They just mention goggles, but they don't give any details on what goggles are. They talk about N95 masks, or as we call them, N95 respirators. Where are you going to get those from? Have you been fit tested from them? Do you know how to use an N95 respirator the way it was designed to be used? Heavy work gloves. What does that mean? Is it Lowe's? Is it Home Depot? Is it Amazon? Where am I going to heavy work? Be more specific. Waterproof boots with steel toes and insoles, not just steel shank. Okay, fair enough. Earplugs or protective headphones and at least 2 fire extinguishers. And then it says, is sewage involved? Now, we just saw the storm surge for Hurricane Milton. We know how toxic and dangerous that water is. We saw on TV, and you and I discussed this just yesterday, people in T-shirt and shorts walking through waist-deep water, celebrating that the storm surge wasn't so high they survived in toxic water. But here on the CDC website, it says, is sewage involved? Yes, it is. All that water has to be considered toxic because we're not testing it for water quality. Make sure to wear rubber boots, rubber gloves, and goggles if sewage is involved, which I agree to, but be more specific, add some more details, help all these wonderful people, again, that we know of that have deployed, or even the building owners and the homeowners, be more specific in how they protect themselves safely. And that detail is lacking.
We talked the other day about something similar to this where, the rescuers, the people going in right away in the water like you're talking about, well, I had my tetanus shot, I'm good to go. That only does one piece of things that you could be exposed to. So proper PPE, understanding it, knowing how to use it. You mentioned the N95 mask. That doesn't do anything for the fumes given off by these chemistries. The fumes from chlorine and stuff like that. So, just because you have a mask on doesn't mean you're protected. So there's a whole series of issues that come up with this with lack of information. And Doug, I know that's a lot of the training that we through Normie and the Environmental Task Force try to push. And it's got to start there.
Yeah, well, I wish we had more and more opportunities. Maybe this will give us the chance to speak to the public, to be able to have those forums and the libraries or with the businesses, to be able to talk with them ahead of a storm. Hey, you've prepared for a nuclear war. How would you like to prepare for a nuclear microbial war? Let us tell you how that works. And I wish we had more and more opportunities to speak to the public and let the public know ahead of time before they get into this situation what it is that they need to do. And of course, that's one of the purposes of our videos that we have, flood.normie.org and hurricane.normie.org. That's one of the reasons why we have those, is for hopefully the public will see that before they get themselves into a jam. And that's the real challenge. And I thank Dr. Gavin for working so hard to help us get this out in front of the public with his influence and his resources. I'm hoping that we're going to be able to talk directly eye to eye with these folks who need protection, whether they're a volunteer or whether they're actual resident. Both sides of the coin. Somebody coming from Tennessee to work on some building in Naples, Florida, he needs to know how to protect himself.
That's a really good point. It's a really good point, Doug. In a post-disaster situation, we do very well with chainsaw safety.
Yeah.
Because we know a chainsaw is going to hurt you if you're not trained properly on how to safely use a chainsaw. What protective equipment should you wear when you use a chainsaw? How do you operate the chainsaw? How do you maintain the chainsaw? Why do we not take that same chainsaw philosophy, approach, practices to cleaning up and looking for mold or preventing mold or taking out mold? Why do we not use the same principles of chainsaw safety when it comes to pressure washer safety. And that always seems to be a step down for me.
Well, and you want to have that balance, which I think is one of the reasons why it's difficult to do. And frankly, I think together we can reach that balance. I've always said in our classes, people talk about mold. Well, it's been around since Leviticus. What's the big deal? That's one extreme. Then you've got the other extreme. Oh, you got mold in your house, tear it down and build a new house. Well, the truth, like so many things, is in the middle between those two extremes. And I think us being able to talk about here's how you protect yourself. Nobody's trying to scare you to death. We're just trying to tell you that it's a concern and you do have the ability to make sure that you do it correctly. Don't look at it as if it's no big deal.
So let's move over to some of the myths that are going on, because I think that's the next piece of this that we really need to talk about. We've talked about what doesn't work or what doesn't work well. What does work for taking care of the mold problems? If you want to address that. Either one of you, whoever wants to jump in here.
Well, I can tell you.
I'll start, then I'll hand it over to you, Doug. Those websites that we've shown have to be corrected, and hopefully we'll have this discussion to do that. More importantly, we've said, straight out, bleach does not kill mold, but we're seeing it being used. The challenges that we have also then, Lance, is that the Federal Emergency Management Agency website talks about hurricane cleanup hurricane cleanup for your property and how to do it safely. And it says on that website, clean and disinfect everything that got wet. We know we can't disinfect everything that got wet, so that's wrong. US Department of Housing and Urban Development, we call that the HUD. Their website says dealing with the aftermath, steps to take for a storm-damaged home, clean with hot water with laundry or dish detergent. How do you get hot water in an emergency in a disaster that has no electricity? So, and why are they even saying hot water? For when it comes to restoring, remediating, and getting these buildings back into a safe indoor condition. And so there are alternatives, and I'll hand that over to Doug. But because the problem is that many of these websites say, yeah, I totally agree. EPA, OSHA, I agree with you. Don't use bleach, but then you don't give the solution.
Gavin, real quick, you used the term to use hot water. Words mean things. What is hot water? Does it have to be boiling? Does it have to be where you can't touch it? Is it warm? There's no explanation there to your point as to what it actually means.
Well, let me just put that FEMA website in there right now that says clean and disinfect everything that got wet. And in our industry, we have definitions for clean, we have definitions for disinfect. That's not possible. The US Department of Housing and Urban Development, which we call the HUD, talks about clean with hot water and laundry or dish detergent. Yep, fine. But again, as you correctly said, Lance, how hot is hot? What is hot? And how do you do it in a post-disaster situation?
Yeah, let me speak for a moment, if I could, to chemistries, because I think that's a really important part of this process. Sometimes you absolutely need to use some sort of chemical to get things actually clean and to kill the microbes that are there. One of the things that we did last week was we sent a case of enzyme cleaner to Florida, to a church down there that needed some help, and they were looking for what kind of chemistries to use. And it was a natural, 100% biodegradable, water-based type of enzyme cleaner. Hydrogen peroxide, vinegar. There are a lot of things that really work. And to Dr. Gavin's point, he's exactly right. It's frustrating when somebody says, don't use this. And we learned that unless you have an alternative. And that's what we learned. Remember when we started Normie in 2004 and we were doing training, and we would say, now you don't want to use bleach. And what was the first question? Well, then what should I use? And so I think the point is that you want to be careful, obviously, with the client that you're working with, or maybe the individual resident needs to be careful that they're using something that they can tolerate. Make sure you've got an SDS sheet, understand what the ingredients are, protect yourself just like it tells you to. And I'll just tell you, if most people actually read an SDS sheet for Windex, they'd be dealing with it completely differently. But read those SDS sheets enzyme cleaners, botanicals, natural products, hydrogen peroxide. There are a lot of alternatives, and that's why we just want to get the word out.
You know, it's important to understand what the product will take care of as well as what it won't take care of. And you can't do the substitution in your mind saying, well, if it kills this, it's going to kill that. Because we're dealing with completely different entities between molds, bacteria, viruses. They all have different strengths and weaknesses, and they're susceptible to different things.
No, and you're right, Lance. And I just want to reiterate what we're talking about this time that we've been on. Bleach, sodium hypochlorite, is an excellent disinfectant. It's an antimicrobial agent. It doesn't kill mold. As Doug has correctly said, white distilled vinegar, hydrogen peroxide. I'm going to throw a question out to you, Doug. I get a lot of calls in the last probably 48 hours. Sodium borate, borax. pH of 9 creates an alkaline environment. We know it kills mold. I see some use, but not a lot of use in a post-disaster situation. What do you think about sodium borate, borax?
I love it. I just think it's hard to pronounce. No, it is. I think it's hard to find. But no, I agree 100%. And I think it's been proven over and over again that fungus will not grow in alkaline environments. And so having something like that, I think it's a great idea.
And so he's a real...
You probably know that one of the real effective cleaning processes to mechanically remove mold from rafters and from flooring and so forth is a soda blasting. And that's baking soda, you know. So it's a great option, I think.
So here's our problem, and it is a problem. We've had people on the ground through the Normie Environmental Task Force, and we've done a number of videos with Mason Tamano. We did some videos with Jeff Cross. We got those out. We've had phone calls from the front line saying they're handing out, and I thought it was a few 10 or maybe 100 units of, it's thousands. What I'm hearing is thousands of units of bleach sodium hypochlorite. How do we transfer that? How do we change that to say, why aren't we seeing thousands of units of white distilled vinegar, hydrogen peroxide, borax, baking soda? Why? Just why is that not happening? And why do we still have sites like the CDC, the Center for Disease Control and Prevention, with their guidelines for cleaning safely after a disaster, saying clean up with mold with a mix of bleach and water? Why is that happening in 2024?
Yeah, I think a lot of that has to do with just resources, frankly. Sodium hypochlorite is pretty inexpensive, and it's pretty easy to give away. I'll just plug, if I could, the Normie Pro ETF.org. It's a 5013C. It's anything you donate to that's just like donating to the Red Cross, fully tax deductible. You know, Dr. Gavin, if we had thousands and thousands of dollars, how easy it would be to provide that kind of product and those kinds of services to those disaster areas. It's just, limited resources. And I would love more than anything else to overwhelm those trucks that are bringing sodium hypochlorite in with trucks that are bringing in something that really actually works.
Yeah, and I totally agree with you, Doug. I'm so grateful to the members of ISSA, the members of Normie that have reached out to us, but more all those that have left their families and gone and deployed themselves and responded to Hurricane Helene. And now we're seeing, big deployments from our members for Hurricane Milton. And again, we're going to have boots on the ground. The key is the message has to be clear. It has to be loud. It has to be specific on how to do things safely, but more importantly, based on science.
Well, the Environmental Task Force, Doug, you just mentioned, we do a lot of training, and it's all about educating not only the public, but the contractors, the people that are doing the work. And if you're a contractor in any of these industries, water drawing, remediation, assessment, you've come across people that are getting educated themselves. So you need to be educated to be able to talk to your customer. The last thing you want to do is have your customer more knowledgeable than you are.
Lance, this is the kind of thing that's interesting. We talked about this morning in our admin meeting. We've got a class coming up here in Louisiana in the first week in November. We've got a class scheduled in Tampa the first week in December. Those are scheduled classes on our website. And you know what's happening. already there's people coming out of the woodwork. Hey, I need to get trained. I need to get trained. Where a year ago it was, maybe I'll do it, maybe I won't. And so I know it's like everything else. When there's a fire, you want to put on your fire suit and put it out. And so hopefully people will find out about this, the classes that we've got available that will help them with licensing and certification in the states that require it and in the states that don't require it.
And that's really important, Doug. There are just people have to be making decisions for what we're seeing on the ground. And it's so important that through our normie members, our ISSA members, we get to those decision makers and go, I know you're trying to do your best. I know you're trying to make decisions that will help create safe indoor spaces, will recover from this disaster. But more importantly, how to do it based on science, based on evidence, based on a better process, a better methodology. So again, let's work as a team to do this. But it's so important that, again, if you're an ISSA member and or normie member and you're on the ground and you see things, let us know, because Doug, Lance, myself can then we'll more than happy intervene and contact the mayor's office. We'll contact the local emergency management agency. I'm based here in Washington, D.C. If I have to go down and talk to a federal government agency, that's not a problem. And I'll stand up and say, that's wrong, this is better, this is right. And really get that change. It has to happen now.
Yeah, Dr. Gavin, it's interesting. We've been talking the last several years about essential employees and what that meant during COVID. And we've said for years, and I think it's absolutely true, that our water mitigators, our wet restoration contractors, our remediators, our assessors, they really are the first responders to these kinds of events. They're not identified as first responders, but they absolutely are. They're some of the first ones in there to get things going. And so, if you anticipate a fire in your house, you have a fire extinguisher for a reason. And I think that's the whole idea of getting trained ahead of these kinds of events, because now you're ready. We've talked about FEMA training and all of those sorts of things. Now you're ready to actually be able to be value to those people who need you.
Hey, Doug, that example you just gave about the fire extinguisher is so appropriate here, because having the fire extinguisher in your house is very important. But when the fire breaks out, you don't want to take out the instruction manual on how to use the fire extinguisher. You need to know ahead of time. You need to be familiar with the equipment, train, understand what it can do and what it can't do. You can use a fire extinguisher and create more of a problem. So there's a lot of things that go into training. And Gavin, we talk about tabletops all the time. That's the kind of concept that needs to be out here, and to have all of these valid and scientific facts brought into our training.
Yeah, and what we're seeing, Lance, and it's, we've seen both with Hurricane Katrina 2005, Hurricane Harvey, Hurricane Ian. I can name all these hurricanes off, Helene, recently with Hurricane Milton. These are water events. These are water damaging events. I had a phone call from some colleagues that are both doctors and nurses down in Florida who were in the hospital saying, look, the storm surge didn't reach what people predicted, but we got 2 foot of water through our house, and the house is now unlivable, and I'm going to have to stay in the hospital now before I can go home. What do I do, Gavin? What do we do with a house that had 2 feet of surge and is now unlivable? Okay, it didn't reach the 5, 10, or 15 that we all predicted or that we thought could have been the potential. 2 feet's enough to make a house unlivable. And everyone should be seeing those videos on TV right now from Hurricane Helene, as well as the flooding, as well as the surge from Hurricane Milton, going 1, 2 feet. That's enough to make a building unlivable, unusable. And that's the message that's not getting out there right now at the moment, Lance. So that's where this, again, the training that Normie does, but more importantly, the awareness of key decision makers is so critical. And as you're right, as we do these tabletop exercises, which I'm involved a lot through my affiliation with different organizations as we prepare for hurricane season, it's predictable. What I'm not seeing is that recovery is always a key part of the disaster cycle. And those that are involved in recovery are our members. They don't make the exercises. They don't come to the tabletops, and that has to change, because we've gone very quickly from response, search and rescue, water rescue, now to recovery. And though our members are going down there right now, if not deployed for Helene, they're deploying for Milton. and they haven't been considered by both federal, state, local government, as well as non-government, as well as volunteer organizations, as a key part of the recovery effort. And they are. Drying a building is based on science. Responding to and preventing mold growth is based on science. And the point is that we have to do better at that. And that's something that Doug and you and I are all working towards. And our goal right now is, did we do well in 2024? Not well enough. Are we going to do better in 2020? Are we going to do better in 2025? Yes, we have to.
I want to move back to the 3 points or topics that we originally started here. But just before I do that, I just want to put out there, if anybody's interested in getting more information on the Environmental Task Force from Normie, you can go to Normie Pro ETF, EchoTangoFrank.org. And that's got a lot of information on that page, including how to join the Environmental Task Force and Project Safe, which we've utilized to have our members all over the country check in with us, let us know that they're okay. We actually use the term I am okay, which is I'm okay. So, it's more information that you can get. With that being said, what our original topics were, you must stay safe and healthy, health risks for mold exposure, and the myths of this industry. I'm going to put it back out there if you guys want to sum up these points and
I do have one thing I'd like to do, which I haven't really said yet, but I think we should ask this question. One of the things that we've learned is that Normie has grown because we have really good people, well-trained in the field, and because they look good, we look good. Can I just say that we see ourselves as being able to have an army of well-trained folks out there who can touch the lives of people we have not even met. And I say that to say this: I'm sure there's someone on this call who's listening who could get us in front of the people who make these kinds of decisions. And if you can do that, please reach out to us and let us know. If somebody's willing to talk or listen, we're willing to talk and to show them how important it is that they do things the right way. We love those kind of opportunities. So I just wanted to put that out there. Help us get this information out to people who need it.
Help us help you is really the expression that I like to use. But Gavin?
Yeah, and the other thing, Lance, get the right safety gear. Practice wearing and using that safety gear before you deploy. I work with highly infectious diseases, or those diseases of high consequence. I practice in the dark because most of the time when I'm working, the lights go out. And if I can't put on my personal protective equipment and take it off in the dark, then I'm going to fail in the real world situation. So get the right personal protective gear. If you're deployed, pace yourself. I see so many people run in and it's hot, it's humid, it's an austere environment. There are dangers there. There are hazards there. Pace yourself, ensure you've got, a lot of these places now still don't have electricity, access to clean water, access to clean and safe drinking water. Stay hydrated. If you're going to take so much precautions and training when using a chainsaw, then apply those same principles to pressure washing, and apply those same principles to cleaning up after the hurricane or the disaster, the flood event, to prevent mold. And the other thing is that I see often, and we saw this on TV. You and I talked about this yesterday, Lance. Don't underestimate the danger of floodwater. It's toxic. And it's toxic because it has sewage in it, it has agricultural products in it, it has contaminants in it, it has all sorts of things in floodwater. And I think people underestimate what floodwater, the health risk that floodwater can pose to you, and understand that if you get open cuts or sores, which you will, that are exposed to floodwater, you've got to clean them, you've got to wash them with soap, you've got to ensure that they don't get infected. I deploy a lot in disasters, and I see a lot of skin infections. And so it's really important that don't underestimate the hazards that are in that environment you're going to help after a flood event, which we're seeing from these hurricanes right now. And I think that's the problem. I see people working right now in short sleeve t-shirts and shorts. Not on my team. Doesn't happen.
You know, common sense is the term that comes to mind here. The unfortunate part about common sense is people think they all use it. And common sense isn't something you're born with. It's something you learn. You know, you've learned how to do things, and then you make your decisions based on that. How many times have you been to a disaster site where you see firemen running around, full breathable pack scuba systems because they've been in fires, forest fires, or house fires? They come out, they take off their breathing equipment. What's the first thing they do? Light up a cigarette. It's it's just not something that makes sense, though it's what people do in the heat of the moment.
No, you're so correct, Lance. The people that respond to disasters within our network are the most wonderful people you could work with in the world. And they become, very good friends because we all have the same commitment to service. The challenge I've had with so many deployments in disasters and emergencies is that those responders had then had to be rescued.
Yep.
They didn't drink enough. They didn't stay hydrated. They didn't know how to treat cuts and wounds or abrasions, and that got infected. And suddenly we had to get them out of the deployment area. They had to get them out of the disaster area because they just didn't understand what it took to keep themselves healthy and safe in working in such an environment.
Which then becomes more of a draw on the workers that are still there trying to work, taking care of the rescuers. So yes, it's a downward spiral when that starts to happen. Gentlemen, we're coming up on close to 45 minutes here. Anything else you'd like to cover that we didn't? I mean, we're pretty much open at this point. Anything that we have missed?
There was a couple of topics in the chat there, Lance.
Oh, let's see what we have here. I appreciate the feedback, very helpful. As someone who is just returning home from a fire department after Milton's landfall, with extensive water damage throughout the structure. I'm just shortening up fairly long here what was written. What are the solutions you all offer for public servants to boost the message out to the community? Suggestions on what they can do. Offer free training to your emergency services. We have a program called FRAP, First Responders Awareness Program, where we help you provide instructions to your emergency service organizations how to protect themselves. It's pretty standard stuff, but you have to hear it over and over and over. Anything else, guys?
Well, I was just thinking about being bold enough to actually even address the issue. Sometimes people are kind of wary about promoting something that may look like they're trying to help themselves, but the truth of the matter is that when you are bold enough to be able to talk to folks who need to hear this, the decision makers, when you're bold enough to do that, think about how many hundreds and thousands of people that you are helping who are out there in the marketplace just trying to survive. And I think, as Dr. Gavin said, we forget sometimes about those folks that had just a little bit of a problem, but it's, you know what, it's their house. It's a big problem. And it's something that they need to be able to take care of in the right sort of way.
You know, the good first responders also need to be able to take care of their families and themselves to be able to have the time to go and be first responders. So that's another part of the equation that we didn't address tonight, but it's one of the important pieces. With Katrina, they learned where they had hundreds and hundreds of buses, school buses, staged to evacuate people, but all the people that were driving the buses were evacuated. This is the kind of thing that common sense doesn't take care of, but you need to be trained and have a plan for it.
Yeah, be respectful, Lance. If you're deploying down to a disaster, people are traumatized, they're upset, they've lost personal belongings, their businesses, the buildings, both home and commercial, have been damaged. Be respectful. Be a good listener. But more importantly, when you go back to the emergency operations center and they're telling you to go faster, that's not always possible. And there's times where I've been leading teams, I'm going, stop. That's going to make this whole situation, which is already unsafe, and it's going to increase the risk for injury and damage. We have to slow down. That's not safe to go in there. That building has been closed. The windows have been closed. The door has been closed. There's sandbags at the front. It got flooded. It's been a week to 10 days before anyone's opened that. And you want me to go in there and do what? And if they don't have the proper personal protective equipment, the gear, the safety gear, you can't rush into those buildings. And that's so important. Again, have good decision makers, good management, good leadership, and then you've used that word common sense. I try not to use that in a disaster situation. I try to focus on the hazards. I try to risk, and I say, what's the worst that can happen? And I start that with all my conversations, because people they rush. They when they go fast, they get hurt.
There's a very good comment here that I want to put out to both of you, and whoever wants to jump in on. There's a few things here. As a follow-up, community members are asking us directly, what do we do? What cleaner should we use? If not bleach, what? We're already getting those questions from our community members.
So I think there's a couple of links, and he identifies this. That's Ryan. A couple of links I put into the chat area, one for volunteers and one for residents, and that's in our Normie Pro ETF. But we also have a great section of our normie.org webpage on the very bottom, resources for the do-it-yourselfer. And I think that's a really, really powerful little paragraph. It's got several links in there. I was just looking at it again. I know we have a resource library that will help them with getting information that they need, accurate information. There's information there about enzyme cleaners. I also have my book there, Mold-Free Construction. So I think there are a lot of resources at the bottom of normie.org that would really help give you the tools that you need. And I'll tell you, Ryan, if I were there, I'm in Louisiana right now, but if I were there, I would take those flyers and I would be printing a bunch of them out and probably handing them out to everybody I know, walking up and down the street. That you talk about how you could help. I think that would be phenomenal, is just getting that information out.
Just try to pay attention to the addresses that we're giving you. The chat may not be available if you go back to watch this as a replay. It's normie.org is one of them. And the other one that we gave out a few times was normieproetf.org. And from there, you can access a lot of information. Gavin, I'm not sure if you had another site you wanted to give out.
No, I totally agree with Doug. Let's again, the challenge we have, and I think we've correctly, and we've been good citizens on this webinar by showing the U.S. government, at the federal government level, which also then translates to what's at state government, local government, as well as those other wonderful organizations that respond. The information at the moment is misleading. In some situations, it's completely wrong. In some situations, there's not enough detail to be able to do a job that keep you safe. So really important. If we get too many mixed messages, as we're seeing right now, and we've talked about in this webinar, it leads to unsafe, or it leads to actions that aren't based on science and evidence, and that leads to mistakes. So it's really important that these events aren't going to go away, Lance. This is just, we've had 2 hurricanes, both made landfall, caused significant hardship, significant damage, significant problems, and we're seeing from our wonderful ISSA members and Normie members on the ground right now, real reports that things are not being done the best that they can do, and there are ways to do this better.
Doug, any last comments here?
I don't think so, except that I just want to really thank again Dr. Gavin for being here. A great asset. He's been a big help to us, and just thank you so much to him and ISSA. This has been a great collaboration and a good partnership. I'm looking forward to the great things that we're going to be able to accomplish together.
Yeah, it is important, Doug. I'm glad we met all those years ago. I'm glad that but more importantly, we're doing this as it's a team. It's a true collaboration through our Normie ISSA Alliance, and there's room for many, many more partners.
Thank you both for taking the time to be here. We appreciate it. And everybody else that's watching, thank you. And I'm sure there'll be more information coming out in the near future. And please be safe, whatever your involvement is with this disaster. Thank you.
Imagine a river in the sky carrying vast amounts of water vapor equivalent to what some sources say could be 25 times the flow of the Mississippi River, surging through the atmosphere and unleashing torrents of rain when it makes landfall. Have you heard of these? If not, you're going to Google it. It's interesting. These are atmospheric rivers, powerful weather phenomena that can bring life-sustaining precipitation to drought-stricken areas or floods and landslides to others. It's not good news. And to talk about this issue today and what's going on in the world around us, I welcome Dr. Gavin McGregor Skinner with ISSA and Doug Hoffman with Normie. Gentlemen, always a pleasure.
Hi, Jeff.
Hey, Jeff. Great to be here.
Good to have you both. Gavin, let's start with you. What are you seeing out there that's happening as far as interesting storms or deadly storms that we need to know about?
Yeah, this is really important for people to understand, Jeff, that California storms can be just as intense and destructive as hurricanes in the southeast and the south of the US. Wet buildings can lead to microbial contamination and growth. Now, we know in the past 25 years, all 58 counties in California have experienced at least one significant flood event. And we know that more than 7 million Californians, that's 1 in every 5 residents, lives in an area at risk of flooding. But what happened 2 weeks ago, Jeff, as you said, that this atmospheric river or this bomb cyclone that hit California broke records. The storm brought to Sonoma County 3 times its normal November rainfall. The storm dumped 12.47 inches of rain in 3 days in Santa Rosa. That qualifies it as a 1,000-year rain event. And so we have to remember, wet buildings lead to microbial contamination growth. But more importantly, preparedness, Jeff. Preparedness for disasters should include the anticipation of internal events as well as external events in order to ensure the best response when disasters occur. So through the Normie ISSA Alliance Agreement, we are focusing on helping people find the right resources, not just after hurricanes, but also after these huge, massive California storms.
Thank you, Gavin. Now, Doug, I know your team at Normie is always ready. You do training, support, you're there to help. What are your thoughts about what's happening right now?
Well, I want to really underscore what Dr. Gavin said about preparedness. I think oftentimes folks don't even think about this until after the fact, and then they say, now what do I do? We, of course, have made available through our task force, flood.normie.org, hurricane.normie.org, short videos that help folks think in terms of preparing for what's inevitable. And then I think giving them the tools that they need and the training that they need to not only deal with the problem, but maybe supervise the work to make sure that it's done correctly. One of the interesting things that happened to us, Jeff, after Hurricane Katrina, we were doing a training, actually doing it in my house because there were no hotels available. But half of the people that attended our training, and that was a licensing class, were homeowners. They weren't going to get licensed. They weren't going to get certified, but they wanted to know that the work was done correctly. And I salute the states that have moved toward not only licensing, but also toward regulation to make it available, information available to the public dealing with mold, the effects, the bad effects of mold, and then recommending professional organizations, not companies in particular, but professional or trade associations that can do training for professionals as a resource for clients to find people who can deal with these mold problems after some type of water event.
So we don't hear about the issue like in California as much as we hear about hurricanes when they hit land. But it sounds like they can be just as devastating in many ways. So why is that?
Yeah, again, these are rare events, Jeff, but they're happening more often now. And as we said, 25 years, all 58 counties of California have experienced at least one. The event 2 weeks ago was a massive storm. You heard the terms used, atmospheric river. Doesn't really resonate like it does hurricane, tornado. But and then we heard bomb cyclone. Okay, now we're starting to get into the sort of disaster type lexicon of words that actually resonate with people. The event 2 weeks ago was a massive storm. You heard the terms used, atmospheric river. Doesn't really resonate like it does hurricane, tornado. But and then we heard bomb cyclone. Okay, now we're starting to get into the sort of